The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Happy Friday. This is Darren Paskey. I'm the Supportive Employment Program Manager for Western Washington with the Healthcare Authority. And for everybody is here for the IPS Reviewer Part 2 training presented by Paul Phares, the Director of Community Support and Care Coordination with Unity Point Health at the Robert Young Center in Rock Island, Illinois. Paul has a wealth of experience and years of experience providing IPS services as a consultant with the state of Washington and providing IPS reviews in the state of Illinois, and I believe working with other states as well to implement the models and assist with IPS reviews. So with a warm welcome, Paul.
Thanks very much, Darren. I appreciate it. Just do a quick systems check. You can still hear me, I hope, and hopefully folks can see the PowerPoint.
I can, yeah, components of a fidelity review.
You got it. Okay, perfect. And so we'll start today, like we started yesterday, just by doing some housekeeping. And I'm seeing a lot of yeses that people can hear and see what we're saying, and that's great. Awesome. Thanks for responding. So we're going to do similar format to yesterday, everybody. Welcome back to part 2. We're going to talk for about 50, 55, 60 or so minutes. And then we'll take a short break so everybody can do whatever they need to do, stretch their legs at a minimum. I don't know about you all, but my hip flexors are killing me just being seated all day long. So I do feel the need to get up and move around a little bit. We are going to do kind of the second half of the Fidelity Scale review today, and then we're going to spend whatever time we have left, hopefully it's a lot of it, talking about how fidelity reviews happen, how you prep for it, what kind of interactions you have with providers prior to the fidelity review, and then certainly the 2 days of the fidelity review, what you can expect to see. We'll even talk a little bit, and I want you to think about questions you might have, those kind of like, what do you do when type questions. Those are good questions to have for the group. We may not have all of the specific answers. We may be dealing in hypotheticals, but that's okay. If you're like me, like I was when I was at this point in getting prepared to be a fidelity reviewer, your head is filled with probably mostly questions. And so I do want you to have the opportunity to ask those. And I will spend some time at the end really just having an open forum so you can ask whatever's on your mind. And like I said, when we've done these in the past, not just with Washington, but when we've done these in the past, a lot of those, what do you do when you see this type questions are the ones that generate the most conversation. So I do want to spend some time near the end. I'm hoping to end a little early so we have time for questions, more than 15 minutes anyway, to make sure you've got all your questions answered. So let me just kind of start right out of the gates by asking the group here if there's anything that, after you spent time with me a couple days ago, if there's anything that bubbled up as a question for you before we even get started. That could be anything we covered or anything just that we haven't covered yet that you thought, well, yeah, but what about this thing? Because I'm happy to start with your questions. So I'll just take a couple minutes while everybody's getting settled here and wait for a few questions to come in. And if there aren't any, we'll just go ahead and proceed. And that's fine if there aren't any, but I'll just wait a minute or two and see if there's any questions that come in.
Great, and just for housekeeping, please use the questions on the sidebar on the screen that I'll be monitoring those to provide some information to Paul. Yay, Austin, for spending some quality time with the review manual. I still find myself doing that quite frequently.
Yeah, me too. Just when you think you know it all, you see something that makes you scratch your head. And so when I say, have it with you on a fidelity review and refer to it, even with your own IPS program, I mean it. You can't know it all. It's what, 273 pages or whatever. You can't know it all. And even if you did know it all, there's, like we talked last time, there's those little one-sentence statements that are the things that I told you to put a star by or highlight or whatever. Those are the things that are kind of almost between the lines that even if you remembered all of the major content, there's still all those little qualifiers that are in there for a lot of the items. So it can really be a challenge. And Austin, you're doing the right thing. The best thing you can do is just spend some time with it. I'd encourage you to be healthy with it, though. You know when to put it down, have hobbies, all of those self-care things. Just I'm a counselor by trade, so just want to make sure folks are taking care of themselves too. I don't see any other questions, so I think I'm going to just kind of get into things. Where we left off was disclosure. I'm just going to kind of start there again. I do see a question that popped in. Okay, work in progress from Austin. And Ronnie has a question here. What happens if an agency is being evasive about documentation and say they can't show you because of HIPAA? Ronnie, this is a great question. This is a really awesome question. So, and we'll talk about this when we talk about kind of the fidelity review process. One of the underlying sort of assumptions with fidelity review process, and you have to think about how it's kind of set up. So I'll just talk about Illinois because that's kind of my home base. In Illinois, we're funded partially by the Department of Rehab Services, and individuals from the Department of Rehab Services and individuals from the Division of Mental Health in Illinois are our fidelity reviewers. And since they are our funders, there is sort of a continuity of care agreement wherein, not to say HIPAA doesn't apply, but as part of us being funded by them, they are able to come do a review, which means they look at our records. So that's kind of one part of it. The other part of it is, as a fidelity reviewer, if you put on your fidelity reviewer hat, when you go to an organization for 2 days and you're talking with consumers, you're talking with family members, you're looking in records, maybe you're talking with therapy staff and IPS staff, all of that sort of documentation and interview content needs to stay at the organization. There are some reviewers who they want to take parts of a chart home, and I don't. That's not how I review. That really scares me, to take part of a medical record like back to the hotel room and review it. I don't ever want to do that. I want to review stuff in the organization, within those walls. If they need to have somebody present with me to satisfy sort of their privacy officer, that is fine. And I think I talked the other day about how even when going through the charts, there are some organizations that say, as a reviewer, you can't go through the chart, but if you need to see certain parts of the chart, I'm happy to show them to you. And all of those things are fine. And each agency regards privacy in a little different way. It's almost like an interpretation of the same rule. So Ronnie, it's a great question. I've never had an organization that says they can't show me things because of HIPAA. And usually it's because of that sort of, I don't know if it's implied or overt sort of association with the fidelity reviewing body in that state that says, again, not that HIPAA is waived, but that the reviewers, they're professionals and they will, what's the right way to put it? They will abide by all HIPAA privacy rules under the auspices of the fidelity review. So Ronnie, I hope that answer makes sense to you. If the agency is being evasive, that was the first part of your question, that's a different sort of discussion. We can talk about that a little bit later when we talk about fidelity review process. But I've not had anybody say they can't show things to me because of HIPAA. And I would, even if I teased that out and said, well, what if they did? I couldn't score it if they refused to show me things, would be the short answer. So I suppose it's possible it could happen, but it hasn't happened yet.
I'd just like to add an experience I just had with an agency because they didn't want to share information. So I had to get reassurances that we, just like you mentioned, Paul, we are contractors, we provide funds, we maintain confidentiality. And because we do virtual reviews right now, I asked the agencies, for releases for the review teams to share, and I talk about deleting data, because one thing with doing a virtual that we are transmitting more data on secure servers to share, and then have a process to have that information deleted. So I was surprised that I did get some a pushback from another agency's IT department about sharing information.
Yeah, that's an interesting point, Darren. I hadn't really considered, with COVID and everything being virtual, how that might impact the exchange of information. And I suppose, it's an elegant solution to just say, well, let's get a release of information. I mean, really, that protects everybody. So, if the bottom does drop out, that's a great suggestion to navigate through HIPAA while still maintaining everyone's privacy. And again, in a fidelity review, you know, I go in on day one and usually, excuse me, usually the charts are there and they're ready. And so on day one, you have the chance when it's in the schedule, you start reviewing charts. When I leave on day one, I don't take any charts with me. They stay in whatever room they were in. The staff, you know, if they ask me, what do I do with the charts? I say, well, whatever you want, really. You can put them in your chart room or whatever you need to do with them to lock them up and keep them safe. I'll come back tomorrow and review them. I don't want, even my notes, if I take notes that are like from a client interview, once I'm done scoring, I'll leave my notes there at the agency. I don't take them home, but they don't stay in my notebook. And I've got a couple of review friends that kind of jab at me a little bit, and they say, well, you know, what if somebody asks you a week later, why did you score something this way? You won't have your notes. And I always just tell them, like, you know, I guess I'm willing to take that risk, and it's never happened yet, knock on wood. So I'm just not interested in carrying any private health data with me. I think it keeps me safe, it keeps the agency safe, maintains privacy, everybody wins.
Thanks for addressing that, Paul, because I have that same dilemma on how long to save or keep, because I've had a couple agencies push back on some of my scores. So, excuse me, I'm fortunate that I've kept some of the notes, but I have to come up with a system so I can, you know, get rid of that after a certain period of time.
What we can do, we can talk about it in the Fidelity review portion, Darren, but the short version of what I do is I de-identify anything specific. And so when I arrive at a score, let's say I score a certain item of 4 based on an interview with a client, I will go ahead, the notes that I take home will be the recommendation I make, but they'll be de-identified. It'll say in client interviews, this was revealed, and you know, our recommendation is that you do A, B, and C. So then later, if I had to refer to it, I have my recommendation, but nothing that could tie it to a certain person or a name or anything like that.
Okay, thank you.
And I'm super sensitive and probably on the verge of paranoid about anybody, you know, saying that Paul's got any sort of private data. So I'm certainly probably overcautious, but it's suited me well to this date. So great question, Ronnie. And like I said, we'll talk a little bit more about that as we get into the day here. We left off with disclosure. I know we went through it, but I'm just going to review it real briefly. Disclosure is really us. It's the IPS provider talking with the client about how much they can reveal or want to reveal to an employer about having a disability. As a reviewer, you'd expect to see not just one disclosure conversation, but many for the highest fidelity. And what you would look for, you kind of hear this in interviews, both with the employment team and with the clients. You also see this and should see this in the medical record or in the chart. You should see evidence that they're having ongoing conversations. One of the challenges with disclosure is really finding it. Some organizations do a great job, and they have specific disclosure worksheets that they put in the charts that are evidence of the conversations. Others, you have to kind of sift through individual progress notes or contact notes to find it. That can be a little bit tedious. Other places I've seen will have their vocational assessment where it has a section on disclosure, and then every time they have an additional conversation about disclosure, they kind of go back and update the vocational profile or the career profile. That one's okay. They're all okay. They're all solutions that places have used. And I don't know that there's a best or a better or whatever. At a minimum, you'd expect to see, if there was disclosure discussions happening, you know, a periodic release of information in the chart maybe. But most places have it documented good enough for great scores and fidelity. It's really finding it with them. Common to talk to an agency and they say, oh yeah, we talk about disclosure all the time. And you talk with a group of consumers and they say, yeah, for every interview did I want to disclose. And then you go to the chart, where is it? You know, it's not, I don't see any words. Often that's the times where it's kind of, I hate to say it, this sounds negative. It's not negative. It's kind of like buried in the contact note. So when you're doing chart reviews, and we'll talk about it a little bit later, it's important to really think about, what do I need to be looking for when I'm in this chart? The last thing you want to do is go visit, you know, look at Paul's chart for, you know, item A on the Fidelity review. And then on day 2, you have to go back to Paul's chart to look for item B and item C and kind of reorient yourself to it all over. So you want to try to hit a level of efficiency with your chart reviews. otherwise you'll be spending most of the time with your nose in the chart, and it's really, I try to, I don't want to say minimize my time in the charts, but I try to just move through them efficiently, see what I need to see, and then be done with it. I get more out of interviews and talking with the staff about how everything is set up than I do out of the charts. There's a real short list of things you see in the chart, and so you certainly don't want to spend the bulk of your time in the charts, if you can avoid it, I suppose. And again, don't forget, as a Fidelity reviewer, you kind of get to have a little bit of a chip on your shoulder, and I don't mean be arrogant, but I mean, if you're struggling to find something, just ask. Say, where, okay, you talked all about disclosure with Paul in your interview, but I don't see it. Where would I find it? And more often than not, the staff will be able to take you there, right to it, right immediately to it, and you won't have to, you know, struggle through clicking through anything like that. Don't be afraid to ask them. They're the experts in their own charts. Save yourself some time. The next item here is ongoing work-based vocational assessment. And so this is really all about the career profile or vocational assessment. And the highest score you can get would say that the vocational assessment occurs over 2 to 3 sessions. It's updated regularly when there's work experience in competitive jobs. And it's got sort of these content areas that you'd expect to see in a vocational assessment. I view the chart review as the #1 place to look at vocational assessments. When you talk to people about their vocational assessment, they can talk about it great, but until you see it, it's hard to know, you know, is it or isn't it done over 2 to 3 sessions, and is it or isn't it updated with information from work experience. So what I'll say here is, I mean, it's pretty straightforward what you're looking for. Common pitfall for organizations is they don't document very well that it occurs over 2 to 3 sessions. And what you might see in an organization, for example, is that there is a career profile or a vocational assessment in the chart, and it's got like the staff signature and a date, just got one date. And when you talk with the staff about it, they'll say, yeah, I do it over 2 to 3 sessions, but I sign it on the day that it's completed. And it's a good discussion to have, because the idea, the principle here is that it's almost a living document that you update regularly based on new experience, and you kind of add layers to it. So my standard suggestion is always, when you update it, you know, sign it on day 1 when you start it, sign it when you finish it, sign it when you update it, sign it when you add to it, you know, sign it when you change it, and then what you would see is sort of a chronology of touches on the vocational assessment. And most organizations that are getting high fidelity, you know, they're doing that anywhere. They have some sort of gadget in the record that allows them to kind of update it. So it's again fairly straightforward. It's when you're doing interviews with the staff, you're going to want to know, you want to ask them, how do you do your vocational assessment? And they'll tell you about it, and often they'll kind of talk around what you're looking for. And you can ask, for example, you know, do you complete the vocational assessment in 1 session, or do you take more than 1 session? And often then that's kind of opening up the door for people to say, oh no, well, we do it, you know, usually we start it on day 1, and then we do a little job search too, and then next week when they come back, we'll finish it, we'll kind of finish up the job search, maybe work on the job search plan, for example. So you can get it in the interviews, but this is certainly another one that it's good to validate in the record when you get into the record. I'll skip some of the rationale. That's kind of like reading for you when you have an opportunity. And I think last time we talked, I said I'd have this Fidelity Scale, this condensed version of the scale pulled up, and just so you can see kind of how the scoring works. So the ongoing work-based voc assessment spills over onto the next page, but you can see a score 1 is that the eval is conducted prior to job placement with an emphasis on office-based assessment, standardized tests, intelligence tests, work samples. That's really descriptive of like the old model of supported employment. And if you get to the next page and you look at a 5, it's really just a reiteration of how they describe this item. But important to note, this is one of those sections that has an or statement, like for the score of 4. So to get a score of 4 on vocational assessment, you could see that the voc assessment occurs over 2 to 3 sessions. They help people learn from the job experience and also work with the treatment team. And then here is this sentence is an important one. They do not document these lessons learned in the vocational profile, so it's not updated, or the vocational profile is not updated on a regular basis. So when you have the Fidelity manual, this Fidelity Scale is really important to have with you when you're scoring as well, to kind of sift through some of these or statements. And like we talked last time, there are a few items that have minimal differences in the language between a score of a 3, a 4, and a 5. And specifically, we talked last time about how, you know, one of the examples that I gave you was a score of a 3 was many, ... many of these things occur. A score of 4 was some of these things occur, and a score of 5 was all of these things occur, or something along those lines. So just those little minute variations in language are really important to pay attention to. And I just want to make sure I keep pointing them out to you. You know, again, get better out, circle it with a, you know, a different colored pen, or whatever you need to do to make it stick out. I know several reviewers who have Fidelity review manuals that are, they've got Post-it notes all over the border, you know, with little notes on them to help their eyes go to a certain point. Now this one I do want to spend a little bit of time on, because I think it can be a little confusing to a newer reviewer. So rapid job search for competitive jobs. So this is one where you will be doing chart reviews. It could be that you go to an employer, a provider, and they calculate it on their own and provide that data to you. That is certainly not the standard, nor do we require it to be the standard. Those agencies that do that are the ones that are, you know, exemplary Fidelity. They're super high performers. And it's not to say that, you know, it couldn't be someone in a different category, but it's the kind of thing you do when you've only got 4s and 5s for scores and you're trying to find a way to improve. So in this one, the initial employment assessment and first face-to-face employer contact by the client or employment specialist about a competitive job occurs within 30 days after program entry. So the first thing I'll say here is, it's really good for you in your interviews to spend time talking with the team about what do they consider program entry. I've been to organizations where they consider the first meeting at an organization as program entry, and others where the first, like the first touch with the employment team is program entry. So it's really important for you to understand from the teams you're reviewing what they consider program entry. Because that's what you'll do the calculation on. And so it says here, you're going to use the date of the client's first appointment with the IPS team as the program entry date. So earlier when I said an agency may provide this data to you, that's fine and that's great. But this is why you really want to explore with them, what does program entry mean to them? Because if you only look at their calculation and they're using something other than the client's first appointment with the IPS team as program entry date, it could really skew their numbers. So it's good for you to have understanding about that. And you can, if they provide numbers to you and those numbers are incorrect, you can disregard those numbers. That is okay. I'm going to get, yeah.
One unique thing about Washington State is that we contract with the Foundations of Community Support with AmeriGroup. So we'll see in charts, actually, that first appointment is doing that application for the FCS benefit, and not necessarily entry into the program, because then we see a gap in services because the person is not yet eligible. So that will be one thing that we see in the Washington charts is people do provide us this FCS authorization, but we don't see that program entry until after authorizations by AmeriGroup.
Okay, that makes sense. And you know, each state has their kind of nuances that are a little bit different, which is, you know, if you're someone who is doing Fidelity reviews in multiple states, it can really get maddening to kind of orient yourself to all of those little differences, you know, between, you know, state to state. It looks like someone has a question too. I thought I saw a question. Are you able to see a question out there, Darren?
I just saw something Ronnie had said. I like that they are experts in their own charts. Let me just see if there was anything in the chat. No, I didn't see anything in the chat.
Okay, I just had a little notification. It must have been left over from Ronnie's statement there. Okay, so back to this one here. So the way you do this is you calculate a median. So it's different than an average, and I point that out again because we're not all probably majored in math. So the median is a different sort of way to calculate the string of numbers, and what it really does for you is it kind of eliminates extreme highs or extreme lows in an average. And so, for example, if you had 0 degrees, a range of temperatures, and the lowest was 0 and the highest was 100, and you average them together, you might get an average temperature of 50 degrees. But if you had one day of 0 degree temperature and a bunch of other temperatures that were higher than 50, between 50 and 100, your median might be well higher than 50. So it's just a different way to regard strings of data and really look at the number that's truly in the middle of the list, as opposed to one that is influenced by a middle that's influenced by an extreme outlier. So right here on page 108 is where it starts talking about how to calculate a median. So it says here, to calculate the median, think of these in terms of steps you're going to do. When you're doing chart reviews, let's say you do 10 chart reviews, you're going to want to go look and write down how many days did it take for this organization to have a client in front of an employer or have a conversation with an employer on behalf of a client, because that counts here too. And for each charts, you're going to have different numbers of days, 8, 12, 25, 29, 19, et cetera, et cetera, et cetera. You're going to get all of those, and you're going to write them out from lowest to highest. You're going to rank order them. And what you're going to do then is you're going to take the number in the middle, okay? So the median is truly the number in the middle of that list you just wrote out when you ranked everything. Now, I gave you the example of 10 charts you reviewed, right? If there's an even number of charts, what you're going to do is you're going to take the 2 middle numbers and average them. So if you, for example, had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 for the number of days between first appointment and time in front of an employer, the middle numbers there would be 5 and 6, right? And what you're going to do is you're going to average 5 plus 6, it's 11. 11 divided by 2, it's 5.5. So your median is 5.5 there. And I know I might have moved quickly through that, and like I said, we're going to spend time here. Important things for you to know: only employer contacts that are made in person are counted. So if somebody emailed or had a phone call manager, that would not count. Let's see here. So here's a good example. If an IPS specialist spoke by phone to an employer 21 days after a job seeker entered the program and met that employer 34 days after the job seeker entered the program, the number we would use for this client would be 34 days, because that 21 days was by phone and would not count. Let's see here. In-person contacts may be made by the employment specialist, by the client, or both together. So if you're an employment specialist and you're talking with a hiring manager and you're thinking it's on behalf of a client that's on your caseload, that would count. So we can also consider job development logs in this. Some places do contact notes or progress notes for their job development. Others only have it in their job development logs. So earlier I said you'd be going through the charts, but you may be going through the job development logs to calculate this as well. So let me go through a few of the examples. These examples are really good examples of how to calculate a median. So on this first one, the IPS supervisor does not track the number of days to first employer contact. Park that in the back of your brain for a minute, because that's going to be important in a few seconds. Reviewers read client records and find the following. These are days from first appointment to time in front of an employer. And you can see they've put in rank order these numbers, right? You've got one extreme outlier, 84, and then you got one that was real fast. Great. Except it's an even number of days. So what they do then is that circle is around the 2 middle numbers, and you can see the math here is they average the 2 middle numbers. I should have highlighted more, sorry about that. So if you average those 2 middle numbers, 29 and 31, the average is 30. The median then is 30 days. And because the supervisor doesn't track this information, reviewers can't score higher than 4. So this is another example of an item that you have a limitation as a reviewer with what you can score based on their practice. So they could have a great score, 30 or below in this example, but even though they're doing great work, you can't score higher than a 4 because the supervisor is not tracking it. And when we get into this item related to the IPS supervisor, you'll see more of those sort of things where in order to get all of the points in that IPS supervisor item, there are certain functions an IPS supervisor has to perform to get those credits. And there's interplay between all these numbers and items as well. Examples, the next example here, longer string. Certainly if you're an overachiever as a reviewer and you want to review that many charts, go for it. God bless you. Just as a side note, kind of from a funny perspective, what I have found as a Fidelity reviewer who doesn't mind looking at charts is that when I show up to a Fidelity review, other Fidelity reviewers who don't like looking through charts are certainly happy to let me look through all the charts. They're happy to take on all the interviews for me. They're happy to do whatever they can do to give me time to look through the charts, which certainly is nice, right? So be careful saying out loud that you really love looking through charts because people will let you. So in this one, it's a little bit easier. It's an odd string of numbers. There's an odd number of digits. So literally, you just take the number in the middle of the two, and you can see there's 6 numbers on either side of 33. Therefore, 33 is truly the middle. The third example, okay, the IPS supervisor does track the number of days between the first IPS appointment and the first contact. That's great. During each team meeting, the supervisor asks if anyone met somebody new during the week, whether anybody made a first employer contact during the week, and if job seekers contacted an employer independently during the week. The data he provides to the reviewer since the last review is listed below. And so this one is another one with an even number of digits. Therefore, we put a circle around the middle 2 and we average them. And that 25 and 28 added together, divided by 2, that comes out to 26.5. And the supervisor tracks the data. So it is a 5 on that one. So that organization there in that example is doing great work. It's got some sample questions. This is tough to get at in interviews, in my opinion, especially if the supervisor does not track it. If the supervisor doesn't track it and you're talking in an interview and you ask them about it, there's really no way they could know about how long it takes. So there is a level of importance with the supervisor tracking it. And real quickly, before I turn it out to questions, I do want to show you how they have structured the rapid job search into scoring. For a 5, it's 30 days and they track it. For a 4, it's between 31 and 60 days. 61 and 150 days for a 3, and then it goes on, from there, going forward. So, Darren, I think that was you. Did you have a question?
Yeah, it looks like Ronnie had a question. She said it's too complicated to put it into the chat box. Looks like it's specifically related to Washington providers. Let me see if I can unmute you, Ronnie. Okay.
Okay, wonderful. I'm sorry to interrupt you, and this is giving me so much information, but the question I have, Medicaid has 4 providers, and out of those providers, Amerigroup is 1, but what if the clients have another MCO provider? Do they have to switch over to Amerigroup in order to receive the employment
for supportive employment services? No, we've definitely had people who get like their behavioral health medical services in one place, and they can still get FCS, and then the individual can choose where they want to get those services if it's up to them. Definitely, we have a lot of people who provide services at one location. But there is that fluid ability with FCS to be able to go to other providers. So they wouldn't have to change their primary, if it's SUD, behavioral health, medical, they can maintain that.
Mm-hmm. And would they be required to switch through the MCO? Would they be required to switch to Amerigroup in order to receive the services? Or is that just blanketed across that they can hold on to like their Molina and still get the support for the employment?
I believe so. I would have to double check. I haven't had an instance of that when I was running a supportive employment program. What we find, it's really hard for agencies to serve individuals outside their current agency. I've had worked with one clubhouse who did work with different providers, and the individual was able to keep their primary insurance, and then they add the AmeriGroup because it is just separate for the supportive housing, supportive employment. But that's a good question. I would have to kind of check with my contacts at AmeriGroup to run that by them and get back with you. Is that okay?
Yeah, that's fine. I'm just curious, and I mean, I'm understanding what you're putting out here, but I was just wondering about that part because sometimes you have to switch in order to receive certain benefits from another MCO because one MCO is covering something completely different, and it's not always interchangeable. So that was just my question when he was way back up in the top of this. I'm sorry. I apologize, Paul, for interruptions.
No, that's fine. This is a forum for you all to ask questions. That's fine. It's not an interruption.
Yeah, I'll just have to follow up with you after I get some information from AmeriGroup. Thank you, Ronnie.
Yeah, that's good. That's a great question, and I'm glad Darren's on because I would not have been able to answer that question. Anything Washington specific is going to be a weakness of mine. Just a spoiler alert there for everybody. So if we move through this, individualized job search is the next item, and this is that employment specialists make employer contacts into making a good job match based on preferences, needs, rather than a job market. And this is really where you'd look for an individualized job search plan. Not every organization uses those, but it certainly is best practice to use a job search plan. And I think that's in the set of documents that Dawn forwarded out after our last meeting. The job search plan, you'd expect that it's updated and developed based on the vocational assessment with any sort of new experiences that folks have. You're going to learn a lot about this in interviews, when you look at the assessments, when you look at the charts. And you'll probably learn the most about this by looking at the job development logs. And what you'd really like to see here is that where an organization is looking for employment for a particular client, the type of employment or the employer or the type of job, you're really going to want to look to see that that matches what's on the vocational assessment / career profile for preferences. So if somebody in the vocational assessment says, I'd like to work in retail, I'd like to work in food service, and then you go look at the job development log and you see that they're looking for manufacturing jobs for this client, you can ask, why the change? This is not retail, this is not food service, it's manufacturing, it's working on a line, for example. What changed? Those are fair questions to ask, and it's all relevant to this item here. The idea, again, the rationale is that if people are interested in a particular field and we help them get employment in that particular field, we've got a pretty good chance that they're going to like it. And certainly we know that people change their mind, and we know that some people kind of have this sort of, vague idea of preference, and that's okay, because every time they try something or, go look at a particular kind of position, they learn whether they like it or not, or whether they want to consider it. Let's see here. Just like I said, when a job seeker says he'll take any job, we would expect that the employment specialist helps them think of jobs they might find satisfying and that will be good matches. I think best practices here are when you see a team working with a client that is willing to take any job, rather than the job type being a preference, they might start talking with the client about shift type being a preference, or on your feet versus seated, working the whole day, other kinds of preferences would kind of come into the discussion. Because some people, they don't have a specific preference on job type. They want a job where they're treated well and that they feel like they can, do good work. And beyond that, they don't really have a preference, and that's okay. Good for you to know that when there's no evidence of job search plans, you can't give higher than a score of 3. If you have your highlighter with you or anything you can do to make that stick out on the page, that'll help come scoring. So for this item, the first thing you want to do is look at job search plans. That's the easy way to do it. Once you start looking at job search plans, you can at least start giving higher than 3s if necessary. If I look at the Fidelity Scale, and I know this is small, if I make it much bigger, there we go, that should help. This is a percentage. So again, if you're looking at 10 charts and 9 of them have job search plans that are, doing all the right things, then you're going to look at a 5 for a score. You might look at more charts than 10. A couple times I've looked at fewer than 10, and that gets to be kind of difficult. You really want to, there's some guidance in the Fidelity Review Manual about minimal numbers of charts and how to respond there, and we'll talk about that later. So again, it's a percentage. It's not a calculation though. There's not anything you're going to be able to numbers-wise put down other than what you see in the charts. So if you go into the charts, there's no job search plans, don't even worry about percentages because you can't give them higher than a 3. And so if they're doing what they need to be doing without a job search plan, there'll be a 3. If they're not doing what they're doing, then you would want to consider a 1 or a 2 in this one. Sonia here has a question. I'm not sure I understand this question. Preferences, contributions, attributions, IEP would be the same, or is there another? Trying to think of the right way to answer this. So part of the IPS model is it says, okay, another form. Part of the IPS model is paying attention to a client's preferences for employment. So I'm not really well versed in IEPs, so I might be kind of, out of my element here, but the career profile and vocational assessment are more, they lean more towards assessment than what I know of IEPs. Those lean more towards like plans. So a job search plan might be similar to an IEP. If IEP means individualized education plan, that's what it means to me. So the job search plan should have the same preferences that are identified in the assessment. And if they don't, again, best practices, we would expect that the team goes back and updates the assessment. If somebody comes in and says, I want to be a dishwasher and that's their preference, then they go talk with a potential employer about dishwashing and what the job entails and the responsibilities, and the client comes back to the office and says, no thanks, I don't want to do that, that sounds like that sounds terrible, then I would expect that the team would touch the vocational assessment to update it and say, he changed his mind about being a dishwasher, now he wants to be a busboy. And then I would expect that the job search plan is amended, and now they're looking for maybe busboy jobs, if that makes sense. So you just want to see a golden thread, and it's similar, probably similar to an IEP in that, there's probably some sort of assessed need that an IEP addresses in the same way. So I hope I'm answering your question, Sonia. I am not an expert in IEPs. I'll just be the first to admit it, so nobody has to tell me that. Okay, so
oh, I think that was really good information, because I actually did a review with one agency who in Washington State contracted with the DDA, so they did use kind of that IEP as kind of that first stage to document some of the goals. So I thought that was actually helpful
okay,
for the starting piece. But during IPS, we still want to kind of see what you had mentioned. If they change their mind, we want to see that updated in the chart or on that form.
Yep, and it does get a little confusing, I think, because there is supported employment kind of has that almost parenthetical supported education component that is allowable. And so there are times you might see somebody who is kind of on the fence about whether they want to work or whether they want to, further their education. And it can be complicated, I guess is the best way to say it. And it looks like we've got a question from Julie too. She says, I thought that consumers had to be using Medicaid funds in order to access FCS services. Some state plans may not use Medicaid funds, so checking that the plan uses Medicaid funds is important. Is that right? And so Darren, I feel like FCS means this is a question for you.
Yeah, FCS does use Medicaid funds. Everybody, we have to verify through Provider One that they're actually, having that to be able to access the FCS funds. So I did send an email off to a mayor group to see if I could get a little bit more clarification. So definitely, if it's not Medicaid based, they wouldn't be able to access supportive housing or supportive employment services through the foundational community supports with AmeriGroup.
Okay, great. Let's see. Just want to make sure I am in the right place. Yep, I am. It's got sample questions here, like I talked about last week, which is very helpful. There's also a whole section in this Fidelity Review Manual that's just questions for different stakeholders. So if you don't like the questions they give you under a certain item for sample questions for IPS supervisors, go to the table of contents for the Fidelity Review Manual and look in they've got a specific section that is just questions for IPS supervisors, for example. You might find one you like there. And what will happen as a Fidelity reviewer too is you will kind of develop your own sort of style, your own sort of voice. You will develop certain questions that you land on that kind of get you where you need to go in the interviews. And if you think about it too, I mean, it's a lot to ask to squeeze all of this into 2 business days. It sounds like a long time, but before you know it, you're going to be closing up day 1 and you're going to be like, gosh, there's so much we still don't know. So like I talked last time we talked, I mean, there is like an efficiency that you really need to think about getting to, and you will. The more reps you have and the more you observe, you'll get to that point where you have a level of efficiency where you can have a 30-minute interview with two employment specialists at the same time, and you can elicit with some strategic questioning, you can elicit the answers you'll need for the scores, because it's very easy to get sidetracked and just kind of say, tell me about the work you do, and 20 minutes later you're like, well crap, I don't know any of the answers I'm supposed to know coming out of this interview. So as a reviewer, you're guiding the interviews, but you get to think about it like you're driving the car and they're in the seats with you. You get to kind of take them where you need to go. And again, you can do it in a nice way. It doesn't have to be we're not here to do gotchas, so there's no reason to be, do any sort of trap questions or anything like that. If we move into job development, frequent employer contact, you're going to see 2 items for job development in the Fidelity Scale here. For the first one, frequent employer contact, again, pretty simple. Each employment specialist makes at least 6 face-to-face employer contacts per week on behalf of clients. So you're not going to count anything that's not on behalf of a client. In some job development logs, they identify which client. Others, they just have a little box that says for a client, yes or no. Either way is fine. There's not a right or wrong way to do it, but you do need to kind of know that information to the degree that you can know it. It's got some of the rules around job development that are here for you to think about. It says here that employment specialists use a weekly tracking form to document employer contacts, and that really is the job development log. Most organizations I've ever been to on a Fidelity review have all the job development logs like in a binder or saved in a file on a computer for us to cruise through as reviewers. It is something you expect to see on a Fidelity review. So what you need at a minimum is you need to know whether the contacts were made with somebody who has hiring authority. So if they're talking with people that aren't hiring managers at an employer, that doesn't count. You need to know whether it's email or phone or in person. Email and phone don't count when you're calculating the number. some of that contact has to happen by phone or by email. It just doesn't count as job development. So we're not saying don't do it as much as you just can't count it as job development. Job development has to be face-to-face. Whether contacts were made by clients without the specialist present, those are not included in calculating the number. They're great if a client is empowered and independent to the degree that they want to go talk to the hiring manager at Target. Awesome. It just, you can't count it as job development on, by the employment specialist for obvious reasons. Whether some contacts are made with the employment specialist and the job seeker together, again, awesome. Those are included. And then whether the IPS supervisor reviews the contact logs weekly, that is consistent with good fidelity. So what you do is you look at the logs for 2 months for each employment specialist. And what you do is I'll just go through the example, that's the easiest way to do it. One IPS specialist worked for 8 weeks without any significant absences, made 42 employer contacts during that time. Another specialist missed 2 weeks of work during the same time period and made 24 employer contacts. So the number of weeks is 8 plus 6. So you take out the time away from work, it's 14 weeks. Number of contacts was 42 for the first employment specialist, 24 for the other, that's 66. So you had total for both specialists, you had 66 contacts in a total of 14 weeks. And you divide that, that's 4.7. And this is another where you round down, and the scoring for this item, here it is, they say a 4. Reviewers round down to 4.7, so the score is a 3. Yeah, so employment specialist makes 4 face-to-face employer contacts per week that are client specific, et cetera. And remember, the rounding down is because you can't click over to say they make 5 per week, because they hadn't. They made 4.7. You'd be able to score them a 4 when they get 5.0 or above when you make the average. So it's another one where there's a rounding part of it. So Sonia has a question, which is a good one. Is that modified during COVID regulations? The short answer is probably not. I don't know that there's any official guidance that's out there today, Sonia. I know like the employment team at my organization somehow, despite COVID-19, is having an absolute banner year for job placements and milestones in employment. And we're in an area where multiple organizations have closed, but the flip side to that is there's other organizations, grocery stores, for example, who are in a hiring blitz because they have pushed all of their chips in on like the online shopping, where people can just show up to the grocery store and then somebody from the store puts it in the back of their car and then they pay online and everything. So we do have multiple sectors in our community that, even though it's a pandemic and many people are unemployed, lots of places are hiring right now. So we have encouraged, all of the precautions that are required in order to have some sort of face-to-face contact. So, and that's just my agency, but I haven't seen anything come down from the folks at ipsworks.org. Katrina has a question. Why was the choice made to round down regardless of how close it is to the next number? Great question. And there's multiple items in the Fidelity Scale that round down once you get the average. And the reason is the number that in this example, we had 4.7, I think, right? Yeah, 4.7. So the number you have, the number of job development contacts you have made in that period, according to the math, is less than 5. It's 4.7, and yes, it's close to 5, but it's not 5. So you would only be able to give credit for 4 because you have not yet made an average of 5 per week. If they, really, in this example, if that employment specialist didn't miss 2 weeks of work, they probably would have been at 5. I'll just remind you that these organizations give you the job development logs. So I'm always a fan of giving credit where credit is due, and I'm not saying manipulate things if you get an answer you don't like. I'm just saying if there's another period of time where the employment specialist didn't miss 2 weeks of work, you know, that's something worth considering if this number is not really reflective of the actual work that's being done. So an example I'll give you is if you go in, and this is the example we use in example 1 here, and you find that somebody had a major illness and they were gone for 6 weeks, I wouldn't use that 2-month period. I would use the 2-month period prior when both employment specialists were present, because what's going to happen is you're going to have a really kind of wonky number that's not really reflective of what the organization is doing. And that's the way I do it. That's my approach. And again, we're not here to do a gotcha, but it's really not anybody's fault that somebody was out with a major illness or a surgery or whatever. So I try to balance some of this, like the rounding down, with the reality of the work. And, you know, and I've been on multiple reviews where we do that, and all the review teams that I've been a part of that have done that and taken that approach really review it as a way to be fair and to really get a good look at the work that's being done. So let's see, I'm going to kind of cruise through this a little bit. I'm going to finish this one, and then maybe we'll look towards taking a short break. So the next item is job development. It's a different way to look at job development. It's quality of employer contact. So this one, we're looking at relationships with employers that they do in multiple visits that are in person and planned to learn about the employer. This is another one where you'll rate each employment specialist, calculate the average, and use the closest scale point. So on this one, the big one is you're going to observe IPS specialists meeting with employers. So part of every Fidelity review is employment specialists taking the Fidelity reviewers out into the community to observe job development in real life happening. And it's very cool. It's one of my favorite parts of a Fidelity review. The employment specialists are always nervous, and I always try to spend time really kind of calming them down and letting them know, like, just be you, just do what you usually do, don't worry about me. We usually have a little conversation on the way to the employer about, you know, how do you even introduce me, since I'll just be like lurking in the corner watching you, you know, like, how do you make it not awkward? And so what we always tell folks is just tell them that I'm here to, you know, review the program, and I'm just here to point out any ways that I can help. And people have also been elegant in how they've introduced. There have been employment specialists that are really slick that say, oh, here's Paul, he's training with me today. And it's like a perfect way to just dismiss all the awkwardness, because once you say that Paul's training with me, nobody expects Paul to have any questions or say a word. And so those are really cool too. What we try to do, yeah, and you can, it says here, reviewers ask IPS specialists to introduce them to employers as a colleague. And I follow this advice too. I don't participate in the conversation at all. I just kind of sit and watch. What I would love is when you go see an employer, or when you go do job development observation, you're able, as a reviewer, you're able to see them have a conversation with some employer that they have an existing relationship with, maybe somebody's placed there, somebody who they are kind of just in the preliminary stages of their relationship, like maybe they don't have anybody placed there, haven't had any interviews, and then, you know, ice cream with the cherry on top would be going to an employer for the first time without ever having done any sort of relationship building. Time-wise, it's not always possible to get to all three in one visit. Also, it's worth noting in this section, the time is going to move really funny for you as a reviewer over the 2 days, and it's really important to try to stay on time and on schedule as much as possible, especially with the job development observation. Oftentimes, the employment specialists have set up appointments to go see these hiring managers for the Fidelity review, and so the last thing you want to do is to show up late to the appointment with the hiring manager, because that looks bad on the employment specialist. So I always kind of give permission on the first day to the employment specialist and the employment team, like, tell me where I need to be. If we're doing something and we're gonna make you late for the next thing, then you need to step in. You need to say, we have a thing coming up at 11. We need to leave now. And so, especially in major metropolitan areas where things like traffic might be a concern, those are really important considerations. We really want to regard everyone's time as important, but especially these employers who are taking time out of their workday to just let us watch something. So just kind of a note for you to think about. Let me flip over to the scoring of quality. So the quality scoring is kind of contextual, and this is another one where I think you know it when you see it. You know good job development when you see it, which is why you want to see at least a couple places. Most of the time, the job development is great. With newer staff, you can really tell they're newer in job development. Job development tends to be part of IPS supported employment that people really have to get used to. I've had people say it feels like sales. I don't like hearing no, and that sort of thing. And I remind them that first of all, whatever field we're all choosing for work, we're all in sales in our own way. Is the first thing. And the second thing is, I mean, for gosh sakes, you work in healthcare. You're not used to hearing no. People tell me no all the time. I've never had rarely do the clients come in and say, oh my gosh, please tell me exactly what to do and I'll just do it. Often you're kind of in this push-pull, motivational interviewing type relationship with the people we serve, where, you're not trying to convince them as much as you're trying to help them arrive at that conclusion on their own. And it's not entirely different with an employer. And then I also tell them that, listen, you're working at a healthcare agency. If you strip away all the detail, our job is to make relationships with people so that they trust us. And it's the same with job development. It's all about the relationship. And if they focus on that and kind of prove their value, ideally those employers, I mean, if you think about what employers really want, they want great applicants. We can help them with that. So just at a minimum, that's a great place to start for a relationship. We have something they need. So sometimes with newer IPS employment specialists, the ride to the first job development on a Fidelity review, you might have to kind of, counsel them a little bit to make sure that they're not so nervous that they feel like they're screwing up, because some folks do. So some examples here. Let me see here. It's another round down. Let's see here. The idea would be rounding down, for example, is if you observe 2 employment specialists and one is a 3 and one is a 4 for job development quality, the idea would be the average between those 2 is a 3.5, and you would round down to 3 by saying, we had different scores for the 2, and so we had to round down. I'm always cautious. I mean, that's certainly the numbers are the numbers, but I'm cautious. The last thing I want an employment specialist to think is like, I screwed up on job development, therefore we didn't get a good score. So some of what we're doing with Fidelity reviewing is really kind of coaching people a little bit and delivering the news in a way that's uplifting, when we can. So I've got 2 after the hour right now. I think what I'd like to do is maybe take like an 8 to 10 minute break here so that we kind of come back at around 10 or 12 after the hour. It'll give me an opportunity to fill up my water, stretch your legs a little bit. I'm going to be on mute, but I am, like I said, I'll be near the computer. So if you have questions and you want to type them in, we can start with those when we come back. And I will see you in about 8 to 10 minutes, everybody. Okay, welcome back, everybody. We'll give a couple more minutes here and just kind of wait for folks to arrive. If you have questions or even just kind of thoughts that are popping through your head, feel free to enter those into the questions section. I'm happy to, like I said, answer questions or just kind of work through something if people are just wondering how it all works.
Hey, Paul, this is Darren. I just wanted to share with people that the Washington State HCA is really focused on building a learning collaborative with different agencies. So we are actually we conducted virtual reviews this year, and we'll be looking at conducting virtual reviews next year. Even though, as an example that you had about the job shadowing, we're not able to go out in the community to do that. So we have devised some role playing as a way to kind of assist with that score. It definitely doesn't meet, the research and academic criteria that this model was developed from. So there are some definitely discrepancies in terms of the IPS review process that we're learning today and how we're implementing it to try to continue to support agencies during the pandemic.
That's great. Like we talked last time we all got together. I mean, this is a year where what we're going through is a once in a lifetime sort of adventure, and we're all learning about our own resiliency and all the stuff we thought we couldn't do, without face-to-face. I think we're learning that there are ways. They might not be exactly the same, but they might be good enough to kind of get us where we need to go. Julie said she guesses her audio cut out. Oh, I'm sorry. Didn't say anything about a break. So I apologize, Julie. If you need to take a break, by all means, take a break. We did take a little 8 to 10 minute break. Austin just kind of put out there that he's surprised how the methods of notation at the organization can affect their score. And he says it's an interesting mix of concerns resulting in an assessment. Yeah, it is interesting, I think, Austin, because really what we've got is a fidelity scale, but each organization gets to determine the way that they record their fidelity internally. So as a reviewer, when you show up, it's almost like you're learning the language of the organization, even though every organization you go visit follows the same exact fidelity scale. Each one of them does it in their own way. There's even some room for interpretation in some of the items that we've talked about, where you might find yourself in a discussion about, the way they're doing it. They interpreted the fidelity scale one way, and as a group of reviewers, you may even have sort of a different sort of idea of how that could or should go down. And so those are all the discussion points that are worth having while you're there. And again, if you think back to where we started with all of this, is that we don't want to do gotchas. That's not our role as reviewers. Then really our role is to understand from providers how they think they're in line with fidelity. And then our job is really to try to interpret that, be the intermediary between their interpretation and the fidelity scale. The fidelity scale is black and white, and that's great. Except, again, like I've said before, the world we live in is not black and white. There is all kinds of variable on any given day in the work we're doing. And so Austin says, yeah, it highlights the need for repetition and efficiency, and the like how you have to reorient at each agency, and that is absolutely true. Each agency, I mean, even when you think you know everything you could possibly know about fidelity, you're going to get into an organization on day one, and you're going to have a question mark in your head, like, what is happening here? I've never seen anything like this before, and that's okay. You've got the manual to guide you. You've got your fidelity review team to help you, and then if you need to, it's okay if you email another reviewer that and say, hey, I'm in a review and this came up. Have you ever seen anything like this? I do those emails, I send those emails, and I receive those emails. I've even had people in Illinois call me on a review and say, hey, I've got you here with the review team on conference call. We are looking at this agency and this particular item in the fidelity scale. Can you just talk it through with us? Not because I'm an expert, just because I'm outside eyes on whatever they're looking at in front of them. So, you know, we talk a lot about a learning collaborative with IPS in general. Your review team and everybody that is trained to be a reviewer, that's all of your learning collaborative. You know, use each other. We're all resources for each other. Sometimes it's really difficult. You find yourself in an organization that's doing something in a way that you've never seen. Sometimes you just need to bounce things off of each other, and that's okay. That is A-okay. You can kind of seek outside counsel when you need to. I would be the first to tell you that, and I'm sure Darren and Dawn would be happy to be involved in that as well. So, you know, if there's a point in Washington where reviewers are operating without Darren and Dawn, I'm sure they'd be happy to have an email from somebody that says, hey, we saw this, you know, what do you think? Because we can all help each other. Let's move into diversity of job types. It is what it says. One of the things you'll ask for from an organization is a list of job types. You'll ask for a list of employers, and it's so you can score items such as this one. Job types are going to be things like dishwasher, stocker, checker. I'm trying to think about, you know, mechanic, coder, et cetera, et cetera. So it's types of jobs that people have obtained. And what you're going to do with it is you're going to look to see if an agency is helping people get employed as the same sort of job type, or if they are really paying attention to people's preferences and kind of seeking out jobs and developing jobs where consumers are telling them they want jobs developed. So the best way to talk about this one is to go right to the examples. There's 2 IPS specialists in the vocational unit. 10 people are employed in the following positions. You've got all of them right here. On this one, dishwasher is listed only twice, so the reviewers count both jobs. But stocker is listed 3 times, so the reviewers cross off the 3rd listing. That's because in this one, 3 is the threshold for a job type not being diverse. So if you have 3, like stocker here, what you do is you cross off the 3rd, you keep the 1st and the 2nd stocker, and then you have 9 diverse job types out of 10 total jobs. 9 divided by 10 is 0.9 or 90%. And if you flip over to the Fidelity Scale, you can see it's a percentage. It's just, you know, 0 to 9% type thresholds, and a 5 would be 85% to 100. I think there's another example. Yep. So 2 IPS specialists in the vocational unit, 11 people employed in the following positions. Drivers listed twice, which is fine, but childcare workers listed 4 times. So what happens with childcare workers, because there's 4, remember you keep the 1st and the 2nd, you cross off the 3rd and the 4th. 3 plus, you cross off. That leaves you with 9 diverse job types out of 11 total jobs, which gives you 81%. And again, if you flip back over, it spills over onto the page, but if you flip back over, that's right in the score of a 4, the range of a 4. This is another one where if they want to argue with you about a higher score, and again, when I say argue, I don't mean they're yelling at you. They're asking you that, you know, you're having a discussion about it. If they want you to raise their score to a 5 because they think they are better than a 4, the math is the math, the range is the range. You know, if one of these childcare workers would have been something else, that likely would have bumped them up into a 5. And so you're really kind of stuck as a fidelity reviewer with some of these items like we've talked about, just because the rubric is the rubric. Now, diversity of employer, yeah.
This is another place where a really good tracker comes into play. I had an agency that didn't fill in all the job types. So there is office listed 6 times, and I had no idea what positions they were. So I had to lump them all into like one, which resulted in a lower job diversity score for them. So I just encourage everybody to make sure they have enough columns on their job tracker to really track who the employer is and what the job is.
Sure, that's a great point, Darren. And I think it's okay for reviewers to tell agencies, you know, like, hey, I think you're not giving yourself credit by categorizing everybody that works in an office as an office worker.
Yes.
While that is a valid job type, there are many, many different functions in an office. And, you know, part of your recommendation in your report may be in that scenario, we think you should kind of distill down a little deeper the job types of the folks that you have working, because you're really missing out. Office worker could mean you could be working in the warehouse, you could be working as a receptionist, you could be working as a somebody in the finance department. I mean, those are all different job types. And to your point, Darren, I mean, they really probably shorted themselves at least a few points just because of the way they described it.
Yes, thank you.
Yeah, thank you. It's a good tip. Diversity of employers is very similar to diversity of job types, except instead of looking at job types, we're actually looking at employers. And again, you're going to ask for a list of businesses where people are working. On this one, don't include anything that people were working before they entered IPS. When an employer is listed twice, reviewers count the employer twice. When an employer is listed 3 or more times, reviewers should ask if the list includes different store locations for the same employer. And this one, I mean, in my world, in Illinois, a lot of this sort of discussion revolves around grocery stores that have multiple sites in a metropolitan area. So, for example, if XYZ store is listed 3 times, reviewers would ask questions about whether all 3 people are working at the same store or if they're working at different store locations. And furthermore, if there are different hiring managers. Some organizations with multiple sites have like a regional hiring manager. Others have kind of store-specific hiring managers. So it's a really good discussion for you to have with the employment team about which is which. So you know which ones to count and which ones to throw out from the count here. So in the examples, there's 2 IPS specialists in the vocational unit. 12 people are employed at the businesses below. So you've got, this nice list of employers. So the senior center is listed twice. That's fine, right? Happy Burgers, though, is listed 3 times. So you're going to cross off one of the Happy Burgers, but count the other 2. And that gives you 12 employers, 11 diverse employers. So 11 divided by 12 is 91%. And if you look at the diversity of employers section, it's the same exact rubric. 85 to 100% is a 5, 70 to 84% is a 4, 60 to 69 is a 3, and so on and so forth. These are fairly straightforward, but I like to really just kind of go through them just a little bit so folks can take a look. On this one, the Hilliard department store, similar to the diversity of job type example we went through, we would maybe cross off 3 and 4 of Hilliard and only count the first and the second. What they don't show you in the example is that discussion. It could be that there's 4 separate locations for the Hilliard department store, and they're different hiring managers, and therefore you could regard it as different jobs, different employers in a certain way. So that discussion really is it's going to be a kind of a hinge for you on the scoring. If we move through and look at competitive jobs, this is what we're all here about, right? Employment specialists provide competitive job options that have permanent status rather than temporary or time limited. Competitive job is a job that pays at least minimum wage, anyone can apply for, and they're not set aside for people with disabilities. So it is worth noting that seasonal jobs and temp agency jobs are counted as competitive just based on the way they're structured in most cases. I'm sure there's some where they wouldn't be, but so we're going to be asking for the lists of job types and the businesses, right? And so we're going to try to find whether or not these jobs where people are working are competitive employment. It is worth noting that self-employment is competitive employment. So if you're at an agency and they have someone who's self-employed, that is okay. Also, peer specialist positions are competitive positions. And that's a tricky one because sure, they're kind of set aside for people with lived experience, but it's a qualification as opposed to a set aside. And so that's just something to really kind of think about, especially as you're looking at like mental health centers or even substance use providers sometimes have peer specialists that they employ. And so you may be going to an organization where that organization is employing their own peer. And again, if you're there and they've got 5 people employed as peers out of 10 people working, you're going to want to ask more questions, certainly, than if they have 1 person who's working as a peer and then 9 other employers in the community. Really, every review I've been on, the agency provides information to us that helps us determine if jobs are competitive. Often it's a column that says competitive yes or no, or they include the wage information on some of the reports they give us, and that'll tell you certainly if it's competitive employment. The anchors are pretty straightforward. It's a percentage, and if you review 10 charts and everybody's in a competitive job, then it's a 5. If 9 out of 10 are, then it's a 4. That's an easy way to get your percentages, is to review 10 charts and just see how many out of 10 meet the criteria. Under individualized follow-along supports, that's the next item here, number 11. Clients receive different types of support for working a job that are based on the job, the preferences, the work history, needs, et cetera, et cetera. So this one, really, you're going to get this from a wide variety of information, interviews, observation, maybe voc rehab counselor interviews. And so, again, we can kind of skip through the rationale, I think. Job support plans are a good thing to look for here. They really help identify who's responsible for what with regards to helping somebody maintain employment. Written job support plans are required for a score of 4 or 5. So again, if you had a highlighter, I'd ask you to highlight right there, or underline, or circle, or put a sticky note there. Job support plans are really the easiest way to do this. And they're written, so you kind of get like that bonus point for having a written job support plan. It's important, like every other document, to update the job support plan when something changes. If it's not updated, we don't score higher than a 3. And this is in relation to some IPS specialists write a job support plan while developing the job search plan. So if you think about it, the job search plan is when you write that when you start looking for a job. And if you're at an organization and they have a job search plan that they write, and as a sort of another task, they also start to work on the job support plan, that's good work. But if that job support plan isn't updated when somebody is employed or anything like that, even if it's written, we're going to give them a 3, just because it's they might as well not have it. Almost, they're not using it. Some of the examples are, again, pretty straightforward. IPS specialists are unable to share examples of how mental health practitioners have provided job or educational supports. Reviewers observe a treatment team meeting in which the IPS specialist announces that a person has been hired. The team members do not discuss supports. Clients report that they receive supports for school and work from the IPS specialist only. Reviewers don't score higher than a 3. Most job supports are by phone is another one that results in a score not higher than 2. Do they have a 5 in here? There you go. Experienced IPS specialists are able to provide examples of helping people leave jobs to find more desirable positions. 2 people on the IPS team are helped with school supports. Reviewers score a 5. If there were no examples of helping people with career development, reviewers would score 4. And so this one really kind of depends on what you hear. And so these sample questions are important. And when you're observing fidelity reviews, like if you're watching Darren or Dawn on a fidelity review, this is the kind of thing where you really want to try to pay attention when they're collecting this data for scoring. If they're doing interviews and you see them asking questions like these, they get at job supports, make a little note in your book what they asked or how they phrased it, because it's a tough one to there's not a number that'll tell you. It's tough to quantify, I guess, is the best way for me to say. It's another one where you know when you hear it. If we move into time unlimited follow-along supports, this is one where you'll have your nose in the chart on this one. The expectation here is that employment specialists have face-to-face contact within 1 week before starting a job, also within 3 days after starting a job, weekly for the first month, and at least monthly for a year or more on average after working steadily, and if desired by the clients. So most places, well, the easiest way that I have found to be a fidelity reviewer and review this particular item is to have something, some sort of chart review sheet that I either have created or that's available, where it's just got a column for this. When you're looking at a chart on someone who's employed, you want to go look for a contact note or a progress note, for example, within 1 week before starting a job. So you're your Fidelity review kind of sheet, spreadsheet, or whatever is going to say job start date, and then you might have face-to-face contact within 1 week, yes or no, and maybe you write a date. Within 3 days after starting the job, yes or no. And that's the way that I have found really helps me kind of track this when I'm looking at the charts. And we really want to make sure that we get a bead on this through the charts. And you can see the rubric is pretty easy. For a 5, it's everything that I just said is actually happening. We saw evidence of it. For a 4, it's face-to-face contact weekly for the first month after starting a job, monthly for a year or more on average, but it's missing that sort of 1 week before and 3 days after starting a job. Score of 3 is face-to-face contact with at least half of the working clients for at least 4 months. So you see the gradient here is kind of less and less support. And it, you know, the 1, we won't even talk about a 1 because it looks bad, but so essentially the more support, the better their score is going to be. And the examples, you know, are the examples. Like I said, I think you'll most likely find that looking in the record is the easiest way to score this one. Community-based services is pretty easy. It's straightforward. You know, we want folks to be working in the community. That's where the jobs are. It's, I think, in today's day and age, pre-COVID even, with a lot of employers going to online applications, I've been to a lot of employers where you see a lot of office work because they're using the office computers to do things like apply for a position or whatever. And you know, my recommendation on those when it's not where we need it to be for community support or community services, my recommendation there is, you know, where are free computers? Where would the client go apply for this job on the computer if they couldn't come to your office? And often all of the usual suspects come up in conversation, things like libraries or computer labs, or you know, mom's house has a computer. So those are the places we want to try to help clients go to kind of create their own natural support system. And furthermore, you know, some organizations have laptops for their employees, and when employees have laptops, you can go anywhere with a laptop. You just need to have Wi-Fi or some sort of connection to the internet. So I've seen, you know, really unique and innovative ways that people have addressed this. And so, for example, I've seen an employment specialist with a client in their car soaking up free Wi-Fi at the, like in the parking lot of the organization they're applying to. So like they're in the parking lot of Target where they can find a Wi-Fi signal applying online to Target. And you know, it's kind of a corny example, but the reason it sticks out to me is they packaged it so well. They helped the client find the quickest route from their apartment to Target. They sat in the parking lot, applied for the job, and then they drove them to like the nearest bus stop so they could know where the bus route was from Target so they could get back home. I mean, it was just a really, I think, innovative way to community, but not just being in the community for the purpose of being in the community, being in the community with purpose. It was just a great, I'll always remember that. When you score community-based services, you can see here for a 5, the target is 65% or more of scheduled work hours in the community. And then it's just a gradient from there. The way you do it, like a lot of other things here, is you rate each employment specialist, and then you kind of figure out what both of them together average out to be. So very similar to some other items we've had where you average each specialist independently and then put them together to get your final score. But again, fairly straightforward. If they don't have like a medical record or a scheduler that you can just go look at, sometimes their medical record can print off sort of an on-site, off-site report. Often though, you know, without those sort of electronic means, you're forced to kind of look at the employment specialist's calendar or planner, which is fine. And then certainly the job development logs should probably be a part of it. So we've had some agencies where we've had to kind of piece together the medical record, like contact note, on-site, off-site data with the job development data to kind of get a feel for how often people are off-site. Because it's rare that you talk to an employment specialist and they can say, oh, I'm off-site 64% of the time. You're not going to hear that. You'll have to really help them figure that out. Assertive engagement and outreach by integrated treatment team. This is, I call this the never give up item. The idea is that people are going to miss appointments. We would just ask that, the employment team documents their outreach attempts. We'd ask that when they're having trouble contacting somebody, if the client is still showing up for like the case manager or the therapist, we'd expect that the employment specialist reaches out to those team members. We'd expect kind of multiple home or community visits, and where it's applicable and when you can do it, we'd expect some sort of coordinated visit, if possible. I had somebody call these coordinated visits one time a clinical ambush, which I think is a really awesome way to describe it. If somebody's showing up for Darren but not for me, Paul might mysteriously show up at Darren's appointment and say, oh gosh, it's been so long since I've seen you. Oh, you're here to see Darren. Well, good. I'd really like to reconnect with you, just as a way to try to re-engage with somebody. But at the end of it all, once it's very clear that somebody doesn't want to work or anything like that, then we need to kind of stop the outreach. I'm going to look at the example here. IPS specialists report when a person misses appointments, they make a few phone calls, send a letter, and then close the case. They document their outreach attempts. That would be a 2. And that's in line with what we've got here. You're looking for 6 strategies, which is really what the definition is of the item. Service termination is not based on missed appointments or fixed time limits, systematic documentation, et cetera, et cetera. So similar to those items earlier that we talked about earlier in the week, where there's 5 components, you're really kind of ticking off each of these components, and however many you see evidence of is what their score ends up being. So I think I see a question in here. So Julie says, did you say that meeting in the support site office is not being in the community? I'm not sure what you mean by support site. So like, if you mean like the agency office, that would not be considered in the community for the purposes of IPS Fidelity. So if I'm at, agency ABC as an employment specialist, and a client comes into agency ABC to use our computers, I would not consider that off-site. So then Julie has a follow-up. In other words, filling out a job application in the car is better than doing that in the agency office. So I hesitate to say just in the car is better. The example I gave you was in the community, in the car, in the community, but it was just loaded with purpose. And I think that's what makes it stick out to me. So if the last thing I want to say, Julie, is that if you want to get credit for being off-site, step out of your office and go into your car in your own parking lot and have the session. I don't think that is that's not like the underpinning of this. The underpinning of this is the jobs are out in the community. So more often than not, the employment specialists should also be out in the community. But really, I think there's a lot of ways to be in the community. There's a lot of places with free Wi-Fi still. I've been on Fidelity reviews where, for people who are interested in retail, the employment specialist will take somebody like to the mall, which has Wi-Fi, and they'll sit usually they have like a food court or some sort of, a little cafe type area. They'll sit there at a table after they've done job development at mall businesses, and they'll sit there and do the application at the mall in the food court. That's what I mean. It is, rather than go back to the office and do the application at the office, there's many creative ways that organizations have found to be in the community doing this work. But that's a great question, and it's hard for me to it's difficult for me to I don't want to give permission for people to walk out of their office and go sit in their car in the parking lot. That's not what I'm talking about. So at this point, we're kind of through the Fidelity manual. Fidelity review manual, I should say. So what I'm going to do, I'm happy to answer questions if people have them. I'm going to kind of reset this a little bit, and I want to talk a little bit about. I want to start talking about, I should say, the Fidelity review process. And so if I go back to the first page of the Fidelity review manual, the fourth page technically, we're just going to start walking through the earlier sections of this document. Because that's where some of the information surrounding the Fidelity review process is contained. Let me look at our slide deck. So this is a great place to kind of to kind of start. And actually, before I start, I want to go back one slide and just the scoring for Fidelity. I just want to point that out. So for each item, we've arrived at a score, and what you do at the end of all of it is you add up all your scores, and whatever their total score is, that's what their Fidelity score is going to be for the organization. The first thing I'll tell you is for organizations that come in and you score them at a 74, I think it's really important for you to tell them. The first thing they're going to think is, oh my God, out of 125 points, we only got a 74. We're like barely terrible. It's not terrible. The way Fidelity works is once you get a 74 or higher, you have Fidelity to an evidence-based practice. So a 74 is not bad. It's very good. Sure, there's a lot of room to grow, but that's not wrong. I mean, every agency is on its own sort of trajectory with IPS and with any support, with any evidence-based practice they implement. So if you're in a year one organization and they score a 74, they need a pat on the back because that's spectacular. Most year one organizations don't even get 74. They get lower than that. If you're at year two and year three agencies that are getting 74 and 78 and 80 and 90, great work for them. They're in Fidelity. They have Fidelity. It's not bad Fidelity. It's good Fidelity. And I know one of the measures is technically good Fidelity, but Fidelity is Fidelity. There's not a good or bad or better or best Fidelity. You can be every bit of a great performer as an IPS agency with a score of 74 as you can with a score of 125. Sure, research shows that more often than not, agencies with higher scores have better outcomes. But I will tell you, just because I've seen it, there are teams with Fidelity scores of 78 that I'd put their outcomes up against somebody with a score of 124 any day. And at the end of the day, it's not about the number, it's all about the outcomes, right? So in your Fidelity review, remember we talked about not doing gotchas and being inspiring and helping empower these teams. So often employment teams are kind of, I don't want to say stuck, but their score maybe is stuck because of things that are outside of their control. So it's really important that you understand as a Fidelity reviewer or a potential Fidelity reviewer that a score of 74 is still a great score. And so I want to make sure to really kind of drive that home and make sure that you all kind of carry that water too. And Julie made a point here that some organizations express real concern about internet security on some of the free Wi-Fi channels. I agree. I know that's part of it. And at the end of the day, if you're in there for a review and the organization, let's say they have 30% offsite, and the organization tells you, well, listen, we don't want our people connected to any Wi-Fi, outside of this building for security reasons, then I think as a reviewer, I think your answer then is, okay, well, our recommendation will be that your team needs to be offsite more. So they don't have to maybe use the computer offsite. Maybe they need to do more job development on a greater degree offsite, or maybe they need to, there's a lot of ways to do it. It doesn't have to be using the computer on a free Wi-Fi channel, for example. That's just an example, something to think about. Another thing that I have found in my Fidelity reviews that people have discovered is good, safe, secure, free Wi-Fi is hospital lobbies. And also that hospitals are usually in a metropolitan area. Hospitals are usually a primary employer. They employ a lot of people, right? So sitting in their lobby and filling out an application, I guarantee you, I'm part of a hospital health system. We want you applying. We want good people. We want good applicants. So nobody's going to, kick an employment specialist out of a lobby just because they're there to help apply for a job. But great question, Julie. That's a really awesome question. So as we kind of turn the corner into the Fidelity review process, some of the high points of the Fidelity review process are preparing for the Fidelity review, getting the agenda put together, the interviews, documentation review, observation report, recommendations, and action plan. And we're going to talk about them, in a little bit more detail as we go along. So when you're preparing for a Fidelity review, every state has kind of a variation on some of these themes. The idea is you kind of create a timeline. So, really, I think even a preliminary step prior to this preparation is, if I expect that an organization is going to host me for 2 days, the very first step is I need to start well in advance and kind of crystallize good dates for the organization and match them to good dates in my calendar, right? because we're not going to call somebody this week or send them an email this week and say, hey, I want to come by for 2 days next week. We're going to give them ample lead time. And I know, Darren, I'm not sure if you have access to, I know Dawn said she's got kind of a, I don't know the right way to put it, but she's got like a process timeline-wise by which she starts negotiating dates with IPS agencies well in advance of a fidelity review date. Do you do the same thing, the same process?
Yeah, we try to give people ample time to set up the schedule because we're looking at that right now for 2021. And then I start, I try to do 30 days out to start priming for information, send out a letter of the information needed, and then follow up in a couple weeks to kind of see how I can assist in gathering information, or if there's some things that we need to talk about for the upcoming review. Sometimes agencies, particularly non-behavioral health agencies, say we don't have a psychiatrist, so we're not going to do that interview, or we don't have that relationship with another community-based health provider, so we're not going to perform certain team interviews. So that's really been helpful.
Sure. And I think the key is the more notice, the better.
Yeah.
A lot of, for an agency, like you said, they have to arrange all these interviews and all these things in a schedule over 2 days. And most agencies aren't operating at such a slow pace that they can just be like, oh, well, you guys show up whenever, we'll make it happen. Most of the time, they need to do some fancy footwork to make space available and make time available with people. And the other thing, too, is I have found at some agencies, meeting space is such a commodity that hosting reviewers for 2 days really ends up being sort of a jigsaw puzzle of how do we move the meetings out of, if maybe they have one room where meetings can occur, how do we move meetings out of that for 2 days that still need to happen? So all of that goes into it on the agency level. Most kind of reviewing bodies that I'm aware of really do kind of empower the organization to create the schedule. I'm not aware of a fidelity review team anywhere that is saying, hi, agency ABC, I'm Paul, I'm going to be your fidelity reviewer. Here's the dates we're going to come in, and here's the schedule. I think that is, it's best when the agency can kind of set it up. There's so much coordination that goes into it that the agency is, they know best, I think. But the agency creates the agenda. They put the key staff slotted into the agenda, and so it just it kind of goes a little bit better when everything's collaborative, I guess you'd say. In advance of the fidelity.
I would agree with that, Paul, because we find out even though I tried to do the early notifications, sometimes it's down to the day before to kind of finalize the interview structure, just because it does take a lot of logistics on the staff to coordinate everything and confirm.
Sure. I don't think I've been to a review, Darren, where I get in there on the first day and the schedule hasn't changed from the
okay. I'm a good company.
Yeah. Yep. Usually, and people, part of it too is, especially if you're getting clinicians in the interview mix. I'm always very upfront and say, listen, if you need a clinician to do clinical work, forget about my interview. I'll call them on the phone, or I'll do something later, or we'll find someone else that's available. The last thing I want to do for the fidelity review is get in the way of client care. And often I review mental health centers more than anything. And so often I'll get there and there's a crisis, and like in the world we work in, that's what happens. And so it's like, well, Jane won't be able to sit down with you to interview because she's taking care of a crisis. Jane is in the right place. Don't worry about Paul. We'll figure it out. There's always tomorrow or whatever. So I think be flexible is a really good example, good advice for you on the phone that are thinking about becoming reviewers. If you're somebody that likes things a certain way and you're not real on board with change, you really need to work on your self-talk and find ways to, do some self-care, because there's going to be a lot of this is going to feel like it's held together with, tape and bubble gum, I think, schedule-wise. So that's just the way it is, unfortunately. Were you going to say something, Darren?
No, I was just kind of that was with the bubble gum wrapping and stuff. There's through the process, you do have to have patience, and things change. I've even had reviewers who've had emergencies where they had to jump off and take care of things. Sure. So definitely, it's a very fluid process, and expectations, are set. This is a very complex process. Of the expectations and outcomes are pretty high, and things change from the beginning to the end. And like you said, I've actually worked to do the psychiatrist interviews or the VRC interviews or supervisor interviews a week later just because of the scheduling.
Yeah, we've done that too. You have to, right? To be fair, you don't want to not score somebody. So you just try to be as flexible as you can and do the best you can with what you got. In advance of the review, you're going to be either requesting or having them make available upon your arrival the roster of the supported employment staff and their assigned caseloads, list of places clients have worked over the past 6 months with job titles, and those are those job types, remember, that we're going to have to review. Job start dates, job end dates, type of employment. You're going to want to know the number of clients who have participated in situational assessments, and the number of clients who have participated in a vocational evaluation during the last 6 months. I'm going to flip over to the Fidelity manual because it puts really in a really nice package here all of the things you're going to want to look at. So if you look at preparing for the site visit, it talks about, when to schedule reviews and, et cetera, et cetera, et cetera. The list of information to request from the site. It gives a nice bullet point documentation of everything you're going to want to look at in order to score, arrive at a final score at this organization. As far as the activities or interviews to schedule, and I think Dawn shared her letter that she sends to organizations with me, or an email, and I think it has some of these same exact bullet points in it. So this would be sent to the organization saying, these are the things we need you to have in the schedule for the 2 days. You can put them anywhere you want to put them. You can make it what it needs to be for your organization. And like Darren said, if you're an organization that doesn't have a psychiatrist or medical director, great. We don't need to do that 15 minutes. You may add something else in that time, either to make it longer, like this IPS supervisor brief orientation to the agency. If you don't have a psychiatrist or medical director, this may be 30 minutes, for example. That's how people schedule it typically. And it's a pretty robust list of things that we would request, certainly, and have them put in the schedule. So it says when an agency has more than one IPS team, separate reviews are scheduled for each team. That's important for you to know. That can be a real challenge at some agencies that have many, many supported employment teams. There's a team in downtown Chicago that has 13 supported employment teams. And if we were going to adequately review them by the book, we would literally be doing one review a week, basically, on that agency for each of their teams. And so what we've done instead is we do about 4 to 6 reviews every other year. So like this year we do like 3 or 4, let's say 4 reviews, one like a review of 4 of their teams. And then next year we might review a different 4 teams, just because there aren't enough Fidelity reviewers to review that one agency every month of a year. So, and this goes back to you do the best you can with what you got. That's why we're all here, right? We want more Fidelity reviewers because of the need. Let's see here. This document has a sample letter that you might send, and I don't know specifically in Washington that Darren or Dawn would be calling on any of us on this call today to, compose this letter and send it out. Maybe someday down the road, a couple of years down the road or something. But I think at this point, while we're just trying to get people trained up, the idea would be that you're a co-reviewer instead of a lead reviewer. Is I think what Dawn had said on Wednesday. We tell the agencies to base charts on random selection. I don't ever fact check that. They just pick who they pick, and that's good enough for me. We do, want to see records of anybody that we might interview. So if they have me lined up to interview client A and client B, I would hope that client A's record and client B's record would be part of our chart review. That is nice to kind of put those side by side and kind of connect the interview right to, what's in the chart. Let's see, other things here. Here's a sample schedule. And I don't have a feel, Darren, are most folks on the phone, like with an organization that would have had a Fidelity review already or is going to have one?
No, I think probably folks on the phone or on the training today are fairly new. Definitely over the last 2 years, probably maybe done 20 different, baseline and follow-up reviews. So we're still looking to grow that number.
Okay, got it. So the sample review, the time, certainly times are subject to change, and certainly the content or the function at each time is subject to change. Some organizations budget time for lunch, others don't. As a reviewer, I certainly appreciate some time just to, not have my nose in a record or not be interviewing. The shadowing, if people ask me, my recommendation for the shadowing job development is usually to have it right after lunch or, near the end of the day. And it's tough, again, based on a lot of factors, things like traffic and et cetera, et cetera. I mean, there's a lot of things that can influence how well that goes, but it is important for it to be on time. So if we get there on day one and we see the schedule and there's, 6 things in front of IPS doing the job development observation at 11, I might recommend that either we split the review team up a little bit and have one person go do the shadowing and 2 others stay and do interviews, or I might say, what can we move from before the observation of job development to like this afternoon or tomorrow, so that we're not late to do the observation of job development. And like I said, you really want to be mindful of time, and you can see this is really back to back to back to back to back. So if these interviews go over at all, you may be late to the client group interview, and we certainly don't want to do that. So while as a reviewer, it is kind of your responsibility to manage your time. I mean, everybody at that agency can help you do that. It's really important to think about that. And here's a good little part on confidentiality to the question, to the point of the question that was asked earlier. Prior to the visit or on day one, right when you get there, you can ask the IPS supervisor whether the reviewers need to sign any confidentiality agreements. That's another approach. It says here, remove client names from all documents that you take from the agency, but you all now know Paul's opinion is that it's really, really safe if you just don't take any documents from the agency. There's really no reason. I have not found a reason yet that I need to take a document from the agency in order to arrive at a score. I've been doing this for a long time now, and I don't know that there's a real valid reason for me to do that. So that's a way to keep yourself safe, keep the agency safe, and just stay on the right side of the confidentiality. So, okay, so you've sent the letter, you've told them what you expect to see when you get there for a fidelity review. Now it's fidelity review day one. What happens? So like we talked about, like Darren said, unexpected changes in the schedule occur during the visit. Count on it. I don't know that I've been on one where the schedule didn't change. In fact, there have been more than a couple reviews that I've been on where by day 2, like things that are scheduled at 3:30 or 3 or 2:30 even, the review team has met and said, listen, I don't think we need to see that. I don't think we need to observe that. We got it in this other interview or in the chart record or whatever. It's certainly not going to enhance your score. We think we just rather have the time, and we can do scoring during that time. An important thing here, I think, is worth noting, not that I have any doubt about any of you, but remember, you're visitors to the agency. We do expect, I think, as reviewers, I think there's a level of professionality that you need to make sure and kind of decorum that you need to have. It's worth noting, I think, that if you're interviewing on a review with Dawn or with Darren, you're really there on behalf of HCA in the state of Washington. I wouldn't expect any sort of unprofessional behavior or attire or any sort of potentially offensive joking. And again, I'm not saying that any of you are going to do this. I'm just saying it out loud. It's really important to be courteous, It's really important to be flexible, and it's really important, most important, I think, to be professional. You're there on behalf of an organization that's not your own, and the product you're going to deliver needs to have a level of trust with it. So the worst thing that could happen is the review team comes in and is not courteous and not polite, and what will happen is it would really taint the score. The organization wouldn't trust the score, and it just is going to lead. I'm telling you, it'll just lead to more trouble. And you want to be consistent, and that's another thing you'll hear me talk about throughout all of this. Is at the end of day 2, the reviewers are going to do what's called consensus scoring, and we'll talk about that in a little bit. But it is really important that if you're there in 2020, for example, and you have a score that's 114, let's say, and then I come in next year with my review team and I review everything the same way, but I come up with like a score of 89, an agency is going to be devastated by the difference, the inconsistency between those two scores. So it's really important that you work as hard as you can to line up your recommendations with the Fidelity Scale, and you work very hard to understand everything that the organization is doing so that you can score it accurately and fairly so that scores are consistent. Again, the last thing you want is that volatility in scores when nothing has changed at the organization level. It will change at the organization level already. There's going to be turnover, there's going to be, et cetera, those sorts of things. But you don't want the Fidelity scores to change based on a different review team's interpretation of something. That's a really bad look. And I think at some point, HCA is going to really scratch their heads if that's occurring all over the state. So we want a quality product as reviewers. So just again, yes.
Well, one nice thing with doing things virtual, Dawn and I are participating in a lot more reviews to kind of increase, that continuity of how we do things. So that's definitely something we're working on this year. But just a couple of things, challenges that I've learned that when we come in on virtual or face-to-face, people are really nervous. And I've had people really say, oh, this is an audit. And we always try to say, no, this is a learning experience. This is a learning collaborative. This is, quality improvement. So we really try to change the language. But it still comes up. And the other thing that I find is a bit of a challenge, and I know you've mentioned this, is how focused people are on the scorecard. Like you said, even if you get a 75, 76, you're still doing a lot of great things. But then they look at the numbers as like, oh, no, I didn't do well. So I found that that's a bit of a challenge as well, to kind of educate. Well, this process takes change, and it takes a lot of resources, and it takes a lot of time and change, and that advocacy process, because as a supervisor or an employment manager, you're the champion who is trying to instigate cultural change in an organization, and it doesn't happen quickly. It takes a lot of reinforcement and addressing the challenge from different points, or to have create more leverage support within the organization to get to a higher operational fidelity scale functioning.
Yeah, you're exactly right. And you said a word that I think is really important for not only the folks on the call here to hear, but when I think I say it at every Fidelity review, we're talking about culture change. Not so long ago, in most agencies, like all of the agencies we're all working in, the idea of somebody becoming employed in a competitive employment situation in the community was not on anyone's radar. I mean, it's really not that long ago, and it's kind of embarrassing if you think about it. So we're trying to help people understand that everybody can work. Some people say everybody can work, but they maybe don't fully believe it. And all of that little tiny culture in an organization, like you said, Darren, it takes time. Nobody starts in year one and is perfect at IPS Fidelity. It just doesn't happen. You have to build the infrastructure. You have to have a team that does good work. And then you have to kind of shape the organization's culture. And that's why, if you pay attention to the sections of the scale, the Fidelity Scale, you've got services section, which is really your team and the work they do. And then you've got organization section. And that organization section is filled with a bunch of stuff that is outside of the control of the IPS team. It's things like executive support. It's, you know, it's all of these other things, your relationship with vocational rehab. It's all these other things that they're not immediate. They're not default settings. They're things you have to develop. And so you're right. And I think you guys have heard me say over the last couple of days, one of the best things we can do as fidelity reviewers, besides honestly listen to what they're doing, one of the best things we can do is point out all of the great work they're doing. I don't want you all to end 2 days with me and arrive at the conclusion that, well, all we do in a review is go find out what's wrong. That's not true at all. Sure, we're going to find places where we think they can improve their score, but an even greater task of ours, I think, is asking the right questions and finding all of the great work that they're doing. Because when you write your fidelity report, what you're going to end up writing is not just recommendations, but also strengths. And when I'll show you a report before we're done, and I think Dawn might even have sent one out since Wednesday. Those strengths, not to be insincere, but you really want to lay it on thick. So when you do job development observation with an employment specialist, first of all, I don't think I've ever seen an employment specialist do a bad job at it. That's the first thing. Their score might not be a 5, but the first thing I ask when I get back in the car with an employment specialist on an observation during a review is, how do you think you did? And what I try to do then is, most people are pretty honest. Nobody says I did great when they didn't. What people say is, well, I thought I could have done this a little bit better. I thought I could have, I realized I didn't leave my card, so they don't know how to contact me. I didn't have a brochure with me, so they can't look at this when I'm not there. So what I try to do then is I incorporate their own feedback on their performance into my recommendations. Because first of all, most of the time they're right. They know what they could have done a little bit better. But the reality is that they are doing a good job. And, you know, people in the Western culture, we are wired, right? Like if there's a high score of 125 and we don't get it, we get a sad face and, you know, we go kick dirt somewhere. But that is like I said, I'm a counselor. That's a dysfunctional way to think, especially when you're thinking about fidelity, because fidelity is not about getting the highest score possible. Fidelity is doing the best you can do. And there are so many things in the Fidelity Scale that are not entirely within the control of the organization or the team, that it's really important to hammer that home and say, you know, like, you got a 78, you know, great job. It's a reflection of the tremendous work you guys do. And there's no doubt in our minds that, you know, the sky is the limit. And it's not blowing smoke, it's empowering. And what you see is, for agencies that even try to get better at employment, year after year, often their score increases. And sure, next year they might go up by 2 points, but that's all we could ever want. Darren said it, continuous quality improvement. That's what we're looking for. Sure, is it an ideal state if every supported employment provider is maxed out and has a score of 125? Sure, that's fine. Is it a reality? Is it realistic? Probably not, right? And here's the example. Here's the best example. You could have 5s across the board, and if you lose an employment specialist or you lose an IPS supervisor, they quit and go to a different agency or whatever, and your fidelity review happens within 90 days, you're probably going to take a hit on your points. So it's this ever-changing, ever-moving sort of march towards perfection that you never quite attain. That really is the quest for fidelity. You know, it is a Western culture thing, and it's funny, IPS is international. In other countries, when you talk about fidelity, other countries, you view a 75 as awesome work because you made fidelity. You crossed the finish line. It doesn't mean you can't try to get better, but really, instead of the finish line being at 125 points, the finish line should be 74 points for organizations. You know, that's the finish line, is to get into fidelity. And so again, as reviewers, our job is to help them correct some of those thought distortions if we see them or hear them. And really, the best way we can do that is by being proactive in our communications by saying things like Darren was saying, like, it's not an audit. We're not here for an audit. You know, we appreciate you all hosting us for 2 days to, you know, listen to our bad jokes and let us drink your coffee. Ha ha ha. You know, it is all about what can we do to help you all do what you want to do with this program. And there have been times with organizations where I do ask them specifically, like the IPS supervisor, if they're kind of having like a tough time, maybe they've got one of those kind of lower to middle scores, and you know, you can kind of sense that they want to improve, but there's some barriers. One of the things I tell them is, you know, part of a fidelity review is a fidelity report, and I am happy to focus on specific things in my fidelity report if you think it will help your program in the long run. And so what I've talked about with people is, you know, especially with regards to like executive support, where maybe administration is not 100% on board with employment, that's a real barrier for a program. Sometimes you can work with the employment team to highlight certain areas in your fidelity report that they can kind of use as evidence with their administration to say, you know, kind of see, even the reviewers think we can get better at this if we just put a little muscle to it. So it's a way to, you know, join with them, if you want to think about it that way, join with the provider in a way that really does focus on how they can improve their program, because that's the goal at the end of all of it, is to improve the program.
That's an excellent point, Paul, because I do have that conversations with some of the managers. Like, this is a tool that you can use to implement that quality assurance program, utilize and integrate the Fidelity Scale into the quality management process. And they say, well, this might give us some leverage to implement some of those changes. So that's a really good point. The other thing that I also ask reviewers to do is, you know, do some cherry picking about the really good stuff going on so we can incorporate that into the comments skills section, or even recommendations, because there's sometimes where an agency will get 5, but I still like to put something as like, keep that up, don't change a thing, you know, so-and-so is doing a really excellent job reflected by this. So I do encourage people, because that really changes that perspective that, you know, we're all in this together and we want to support people and validate and recognize those things that are going really well within the fidelity elements.
Sure, and that's a good point too. When I write the fidelity reports, I comment on 5s and 4s as strengths, as well as any recommendations, so that there's never a spot where they go look and it's only recommendations. I make sure that when I write a fidelity report, every item, even if it's great, that I comment why it's great, so that they don't get a report that's just everything that, you know, kind of is that we flagged them on. It's a little thing, but I think it's important. Just like you said, Darren, it's very, very important.
It's lots of little things.
Yeah, absolutely. And it also helps year over year to help the organization not view us as people that are coming in and, you know, slapping their knuckles with rulers or something. You know, we're there to help where there's resources. And I think it all works out, like a lot of things, it all works out if you just let it, but you have to have the right intention on the front end. I'll tell you what, I am getting a little hoarse. I'm going to take a break, about a 3 to 5 minute break, and refill my water, and then we'll get back and we will finish up and we'll have some time for questions, okay?
Sounds good.
Okay, I'm back, and we can wait about a minute or two and see if anybody's got questions to type in. I know that this is a lot of information to absorb, especially if you've never gone through a Fidelity review, and I appreciate everybody kind of sticking with it. And don't worry, I don't think anybody's expectation of you is that you spend, you know, two and a half days with Paul and then you're ready to go. I think the idea is this is maybe a foundation for you, and you can add to it kind of like in scaffolding. And the more experience and observations you get with Fidelity reviewing, the more confident and competent you feel. So if you're attending and you feel like, gosh, this is way more information than I thought it was going to be, and I just don't feel like I could do it tomorrow, that's okay, because you're probably right where you need to be with all of this information. And again, nobody expects you to know it all, just because there's so much to know with Fidelity. So it's okay. You're probably right where you need to be. Let's see here. So I'm going to click around a little bit. So this Fidelity review manual is awesome in so many ways. And one of the ways it's awesome is that it gives you suggestions, kind of scripts, for how you can start discussions with clients and family members. And one of the things that kind of threw me for a loop as a new Fidelity reviewer, I got to an organization with two other very, very experienced reviewers. And when it came time for some interviews, the agency had scheduled 3 sets of interviews all at the same time. So let's say like 11 o'clock in the morning, there were 3 people coming in for interviews, 3 sets of people coming in for interviews. And of course, with 3 reviewers, maybe your reflex is, well, 3 reviewers, three sets of people to be interviewed. Great, each of us will take 1 interview. Well, I had never led any interviews with anybody completely solo. Up until that point, I had either observed only, or I had been like in a sort of tandem interview with another reviewer. So I really learned to lean on some of these scripts for interviews as a way to, I don't know, kind of make myself feel a little bit more confident during the interviews. And as I said, the more I did interviews, the better I felt about them. The long and the short of it is, while some of these may seem hokey or so on and so forth, that's because today you're not in a Fidelity review setting and nobody's asking you to lead an interview by yourself. So read through them, even if they seem a little hokey and they don't feel like you don't feel like they're in your language. Feel free to edit them and make them kind of your language, or develop your own script. The good news is, really, just to kind of demystify interviews during a Fidelity review, the best thing you can do is kind of ask a question and listen. You don't have to really lead the interview by talking a lot. I mean, that's really not the best example anyway. I always like to start interviews with, this one at the top. Thanks for taking the time to meet with me today. My name is Paul. I work for blah, blah, blah. I'm here to work with this agency, whatever the agency is, and really just to learn more about the services they provide, to try to help them make their employment program better. And I always like to tell people, especially clients, please feel free to be open and honest with me. I encourage you to, just answer questions truthfully. And I want to make sure that anything you say, nobody's going to get in trouble for anything you say today. And I've seen over the years, often with that client group that you're interviewing, they may have felt like somebody didn't return their calls promptly or something like that. And maybe they're afraid to say it because they don't want to get them in trouble. And so sometimes giving that sort of permission to people and letting them know that, like, I'm not here to get anybody in trouble. I'm here to find ways to help them out. And if you guys tell me there's nothing they can do different, that they're awesome, that's what I'm going to say. However, if you also say, or instead, if you say, they are great. I would like them to be a little bit more prompt with returning phone calls. I can tell them that, and it doesn't have to come across as bad. You know, they're busy, and I understand that, and you understand that, but it's feedback, and if we don't tell them, they don't know it. So again, check into the scripts. Even if you think they are corny right now or not anything you would say, you can always tune them up, you know, make them your own if you want to think about it that way. Another thing that's worth thinking about is tailoring terminology to the organization. So each agency calls people different things, right? The people they serve. Some people say clients, some people say consumers, some people say customers, some organizations say patients, some organizations say residents. I mean, you kind of have to hear from the group when you get there on day one. What are the people who use your services? You know, how do we refer to them? And so in every interview, I ask if it's okay if I take notes. I think it's good. It's kind of joining with somebody from a therapy perspective. Completing the Fidelity visit. Okay, so before we get to consensus scoring, so the way a Fidelity review is going to go is you'll get there on day one. You'll have the sort of most up-to-date schedule in front of you. You may spend the first 15 or 30 minutes kind of having like an orientation to the agency that the agency will provide to you. Executive staff, executive team may be present during that sort of orientation just as a meet and greet. Sometimes there's donuts, sometimes there's, you know, like some places have kitchens. I went to one place that had an in-house restaurant, and so they had they gave us a menu and said order whatever you'd like for breakfast, and then they did that again for lunch. So don't count on that. That's the exception to the rule, by the way. Usually it's like Dunkin' Donuts, and that's fine too. So after that, then you're going to start working on the schedule. The schedule is going to consist of a lot of interviews, right? It's going to consist of some observation of job development. It'll consist of chart reviews. But what it's not going to consist of is a lot of alone time for the reviewers to discuss things. So it's a good thing for you to put in your back pocket. When let's say you've got a 30-minute interview, if you finish early, most of the reviews I've been on have kind of like a home base for the reviewers. If I finish a little early, I head back to kind of the homeroom for the reviewers, and I try to just make some notes related to scoring after that interview. And I might make notes that say, you know, saw this, still need to find out about this. If another reviewer comes in, you know, certainly, you know, how was your interview? What did you learn? Is there anything we're missing? Those are little conversations you can have. And then what I like to do with review teams when I'm leading a review team is usually around, I don't know, lunchtime on day one, I like to just get out the Fidelity scoring sheet, and I'd like to just walk through it briefly, very quickly, you know, 5 to 7 minutes with the review team, and just say, how are we doing? Is there anything we haven't seen yet? I'm sure there is. Is there anything we can score yet? There might be. And then what we do is we go through the afternoon after that, and usually at the end of day one, I do it again, where we get out the scoring sheet and we just kind of look and see what else do we need to look at? What else do we need to hear? And then I compare that to day two's schedule. So if we had an interview on day one and we didn't get enough information out of it, you want to let your organization know that, hey, we'll still need to hear or see this, that, and the other, and it's not on the schedule for tomorrow. Can we fit that in? Can we, you know, we don't have to do it the second, but can we find a way to fit that in tomorrow? And what you're doing is you're giving the organization as much time as possible to prepare whatever you still need to see. And this goes back to something I said Wednesday, that like, I want to give people as many chances as possible to provide information to me so that we can give them the most accurate score. At the end of day one, you'll go to a hotel or, you know, whatever, you know, drive home. You come back day two, and it's kind of like the same day. It's like Groundhog Day. It's the same day over again. You'll be there, maybe be a little preliminary meet and greet, and you'll start your interviews. You'll start your chart reviews. Definitely on day two, I want to sit down before lunch and take about 15 minutes and go through the scoring and see what's missing. And then what I like to do then is before lunch even happens, I like to tell the organization, these are the things we need to see this afternoon, period. Not if they get a chance, or like, we need to see these things. And I try to be real concrete. You know, we haven't seen enough to score this item. Is there anything else you can provide? We haven't seen enough to score this item. Is there anything else you can provide? Or what's more common, I think, is In interviews, you guys seem to be doing a lot of work on this item, but when I look in the record, I really don't see that. So can we set aside some time this afternoon so you can either walk me through the record and I can see what I need to see, or if there's other things you can provide to us, allow us to kind of award you the credit for what sounds like the good work you're doing. And again, I'm just trying to be very clear and real with the organization that we're running out of time for me to score things, so I really need to get it from you. And I've never had an organization respond to that in a negative way. Everybody's been very gracious, and I think really what it comes down to is people want us to score them accurately and fairly. So us asking for things is good. That I think that's a good thing. They receive that as a good thing. I know in an interview, often people are nervous or whatever, and they don't say all the things that they could say, or they forget to say something that they wanted to say, or so on and so forth. So we really just want to make sure we get everything that we can from them, so that we can score it. Which leads me to scoring. So there's this sort of phenomenon with IPS Fidelity called consensus scoring. In the Fidelity Review Manual here, it says there's a meeting that occurs within a week of the visit during which reviewers compare the ratings, resolve disagreements, and decide upon final ratings. They discuss strengths to note in the report and recommendations for improvement. So I do that a little differently. I typically have an exit interview at Fidelity Reviews, wherein it's certainly a preliminary score, but we try to spend about 15 to 20 minutes scoring, fully scoring. And then we have an exit conference with the organization where we walk them through the Fidelity Scale, and we say, on item 1, this is where we scored you. We think this is great. This could be tightened up a little bit, et cetera, et cetera. And we walk them through all of that. We give them the final score, tell them it's preliminary and that we're going to review things within a week. So when we leave, people have their score. Of course, it's preliminary, but they still have the score. Other ways to do it are like this, where you don't tell them the score, but then you meet within a week or so to kind of give them a final rating. I don't know that there's a good or bad or better way to do it. I think everybody's just kind of got a little difference. So the consensus scoring essentially is if it's me and Darren and Dawn as reviewers, and Darren and Dawn have a 4 and I have a 3, I either have to convince Darren and Dawn why it's a 3, or they have to convince me, tell me what it is they saw that convinced them it was a 4. And so by the end, we have 1 score instead of 3 scores. We have 1 score that we all agree on. And a lot of what happens is, as you might imagine, with 3 reviewers, Darren and Dawn heard something or saw something that I didn't because I was in a different interview. So sure, I scored a 3 because that's all I saw. They saw additional content that led them to a 4. And again, if I hear that from my 2 reviewers that I'm on a review with, it's going to be a 4 then because they saw it and I didn't, and that's fine. That's another way to kind of fact check everything that, all of the reviewers kind of see part of the fidelity. So by talking it through, you're able to kind of get the full picture. Yes.
I found out that is so important that everybody is a robust note taker, because during this part, we're all going through our notes and looking for that information to share or provide additional information, or maybe there's some deficits or concerns. So I'm definitely surprised. I've become a much better note taker in the first year, and just becoming more robust. And I like to use Word because it allows me to do the word search for different topics or different interviews. So that's been really helpful this year.
That's a good tip. Yeah, and I usually bring a fresh legal pad to every Fidelity review because I burned through probably 75% of a legal pad with all the interviews, and you'd think that, gosh, over just a 2-day period, you'd be able to remember it all, but there's so much that gets put in front of you as a reviewer. You really ought to lean on your notes because you're not going to be able to remember it. Everything's going to kind of blur together by the end of day 2. It's important to remember that the differences between a 1 and a 2 is not a giant leap. Usually those scores mean something, it's absent, it's not present, or it hasn't quite been implemented. You don't really need to spend hours deliberating between a 1 and a 2. The place to spend your time deliberating is between a 3 and a 4, or a 4 and a 5. And if you remember, I talked about how there are items whose rating rubric says many times this happens or sometimes this happened, those are the areas where you really want to have discussion with the review team about, well, was it many or was it some? And you may not have, you may have to finalize your score and not have 100% certainty, but just go with the number you are able to most confidently stand behind. And if you tell them their score, tell them their score and they, react and they want to object and give you, different information, that's a different story. But, consider all the sources, have the discussion you need to have, and, follow the manual. When the reviewers are talking about, is it a 4, is it a 5, or is it a 3, or is it a 4, I would expect all of the reviewers have their Fidelity Review Manual open to that item and are rereading it and seeing what their notes tell them. Because oftentimes there's like one of those little sentences I asked you to highlight that is the deciding factor. That, oh, no, look at this. Yep, it's a 4. We can't go higher than a 4. And again, you're not going to be able to remember all of that. So these numbers, these are some nice bulleted points on, talking about different sources of information, sometimes provide conflicting information, et cetera, et cetera. So this manual, I can't say enough, is so great and such a great resource for you. It's overwhelming, I know, but again, nobody's expecting you to be done today and have Darren and Dawn call you to do a Fidelity review on Monday. So just take a breath. I know it's a lot. It's like information overload. This is the first part of the steps that it would take for you to become a reviewer. So it's okay if you're feeling like, gosh, I feel like I know less now than I knew before I started talking to Paul. It's a whole kind of next level of information saturation. It's got it broken out into the things that an agency is required to collect. So that's nice for you just to peek at. And I'm kind of scrolling through it because I want to make sure I have time for questions for folks. Here's another one. For this Fidelity item, use information from here. For this item, use information from here. It's like this entire book is like a giant cheat sheet for you as a reviewer, which is awesome. Awesome to have. I think I can skip that right now. Go back to 6. Peer specialists. We talked about peers a little bit. Writing the report. So again, I think maybe sometime in the future you can think about writing a report, but maybe not right now. But the whole idea is we deliver to an agency the final report of Fidelity, and it gives you an example of what it looks like here. Here's an example of what one item would look like. So under agency focus on competitive employment, I always, I think my only criticism of IPS Works is that they've got a dash here after the word rating. I would prefer it to be a colon, because the dash, I've had people say, oh my God, did I get a -3 here? And it's like, no, you didn't. There's no -3s. So agencies get worried about this stuff. They want good scores. For these component type items, it's got little check boxes. You put the X in the box, and then as a reviewer, if you're writing the report, you would put what your comments are and what the recommendations are. And so the recommendations, I always say, stick to the knitting. We're only going to recommend things that are in the Fidelity Scale. So like I don't think as a reviewer I am qualified to recommend anything for an agency that is business related, like you should hire a second person or this or that. Like, I don't think I should be telling people to hire. I don't think I should be telling people as a reviewer, to do things that are business decisions, if you want to think about it that way. But I can talk all about the Fidelity Scale. I can tell you, instead of saying, I think you should hire a second employment specialist, I can say the recommendation is to complete a vocational unit, you would need to identify a second employment specialist. And that's a different recommendation than you should hire an employment specialist.
Thank you for that, Paul. Because I was just in that situation. I don't think I worded it as eloquently as you did, so that's very helpful.
Well, I've probably screwed it up 6 times before I got it right, Darren. So I think it's just, you have to be cautious, I think, as a Fidelity reviewer, if you're trying to advise an organization on their business practices. Now, nobody's ever, I don't know of any Fidelity reviewer that's ever gotten any trouble for doing it. And I've seen Fidelity reviews that were, the reports that were written where somebody said you should hire a second employment specialist, for example. I just, and I don't know why I'm so sensitive about that sort of thing, but I just feel like what I need to do is say, vocational unit consists of 2 employment specialists. So, you know, at the end of the day, would it matter to me if they took an existing staff member and made them an employment specialist instead of hiring one? It wouldn't matter to me. That's fine. So, like, I can't tell them the solution as much as kind of the end state, the recommendation, if that makes sense. But I'm overcautious. I think you all know that about me by now. But most of the stuff that's not business related is easy, right? They should share the information about rates of competitive employment with agency leadership and staff quarterly. That is, I'm telling you, that is a copy and paste right out of the Fidelity manual. That's something, that's a point that's awarded if you do that. That's really what you end up doing when you're writing the report, is you're kind of taking the item, giving them the score, telling them kind of, this is what we saw, and then you're giving them recommendations, or you're telling them what their strengths are. So if they scored a 5, like Darren said earlier, yeah, you should put in there, you guys do awesome at this. What I really liked was this, that, and the other. You know, tell them all the great stuff too, because it sure does make, in my opinion, a more complete report for an organization. Okay, so we're back into the Fidelity items. Let me go back here to the slide deck. So in the chart review, some of the documents you would look for are these things we mentioned here. And I don't know that that link works, but I think Dawn sent those out to folks between last time and today. We talked about, so if we were all together, we would be spending time sort of in a group activity, you know, giving you an opportunity to just sit and read in depth parts of the Fidelity Review Manual. And, you know, this might be a good thing for some of you to do if you're colleagues and you're, you know, near each other, or you have each other's emails, you know, just spend some time and just read like one item and then email the group, you know, like, this is what stuck out to me. This was different than I anticipated, and it was just kind of not what I expected. Back to making recommendations, like Dan and I have said, you know, providing recognition and encouragement is every bit as important as pointing out maybe where people could improve. The more you stick to the factual evidence for the scores, the better exit you're going to have in an agency. The last thing you want to be doing is scoring people based on kind of hunches or inferences. Only score what you see or hear. And if people are mad that you didn't see or hear something, then you get to say, as a reviewer, I didn't see it or hear it, and I can only score what I see or hear. Are you able to provide something that will help me score it more accurately? You know, it's not contentious. I've only been on one Fidelity review that was contentious in all my years of Fidelity reviewing. And well, I won't bore you with that story. Someday when I'm in Washington, that's a face-to-face story, not a webinar story. Make recommendations that seem realistic and achievable. You know, the easiest way to do that is to stick to the Fidelity Scale. You should really only be making recommendations that are in the Fidelity Scale. So if somebody is getting a low score on a certain item because they don't have mental health treatment team in-house and they need to reach out to a mental health treatment team outside of their walls, really our recommendation should be that they should connect with a mental health treatment team. The how of it, that's really up to them. And I could give them a lot of ideas, but I probably wouldn't put it in a recommendation. And again, just to, you know, I don't ever want to be like, have somebody come in on a review the next year and think that, well, did you reach out to them in the way that the last review team told you? You know, I know that seems, again, a little overcautious, but again, that's who I am. Breaking recommendations down into smaller steps is always good. Think about, like, if you can do like a goal and maybe some objectives as recommendations, that's a nice way to kind of break it into small bites for them. And certainly every reviewer should have an observation to put strengths and recommendations into into the Fidelity report. Absolutely, everybody should be able to take a swipe at it and kind of give their perspective of it. So I showed you a little bit about the Fidelity report. This is kind of what we talked about earlier, neutrality and etiquette. You know, it's important to be neutral. I don't mean to sound, you know, insincere or anything like that or crude, but I mean, I want people to get as high a score as they can possibly get, but it doesn't matter to me if they get a 90 or if they get 110. I just want them to have, I want them to feel like they had an accurate score and it was fair. So I'm not invested in them getting an extra point or docking them a point because they're being mean or anything like that. So I'm not looking to, you know, inflate or deflate any scores based on anything, any sort of external circumstances. Like I talked about earlier, you know, there's a decorum you have to have. Be polite, you know, don't be demanding. We have the easy job as reviewers. You know, we come in and we review what they show us, and if they don't show us things, we don't review it. And if they're upset that we didn't review it, like we can kind of, that's a circular argument. Well, I mean, I didn't review it because you didn't produce it, and I don't know what to tell you. If you're in an interview and you hear something that is, you know, very obviously out of the bounds of Fidelity, to the degree that you are able to manage your facial expressions, it's very important that you manage your facial expressions. Often, as you might imagine, under this sort of high stress 2-day Fidelity review where you already learned that people feel like it's an audit, oftentimes people misspeak. Oftentimes people say something and they mean something else. And so what you'll find is a lot of times that stuff you hear that, you know, could be terrible and devastating for Fidelity, when you track it down and ask further questions, it's kind of like, no, they knew what they were saying and they just had a slip up. They said the wrong thing. It's not a big deal. So, you know, and again, Fidelity is the responsibility of an organization, not the reviewer. So you don't have to, you know, you don't have any skin in what their score is. All you're there to do is just absolutely be a mirror and provide feedback to them. If they don't provide you with information that helps you arrive at your decision, that's a problem for them to sort out, not for you to sort out. If they want to be grumpy about stuff, you know, that's for them to sort out. We can still be professional. You know, and the more open and honest you are and the more feedback you provide to them, I mean, in general, the better it goes. You guys are in a really good position though, because you're at kind of this foundational level where you're learning about being a Fidelity reviewer. And I know I've talked with Dawn and Darren about sort of the plan to kind of get some observations under your belt. Every time you observe, you'll have another layer of learning about Fidelity, and it'll seem a little bit more clear to you. Right now, it may seem like, what did I even sign up for? And that's exactly where you probably should be, because it's a lot of information and there's a lot of sort of style points to all of this, right? There's all these little sentences you have to remember in a 273-page manual. And but remember, you're gonna have the manual with you. You're gonna have Darren or Dawn or, you know, somebody else who's done reviews with you. So it's not gonna be all on your shoulders. The Fidelity review team is a team. Nobody does anything solo with regards to scoring or anything like that. And the best part is, as a Fidelity reviewer, if you mess up on day one and you don't ask the question you need to ask or don't get the answer you need to get, guess what? On day two, you can ask that question again. You can just say it out loud. You can say, well, I didn't ask in the interview, like, what do you guys do for this? And they'll tell you. So you're not gonna mess up. And even if you do mess up, there's a lot of different ways you can fix it before it's final. So don't freak out. You guys are in a good spot and you've got a lot of support. And I know Dawn and Darren and I have talked about, you know, other things we can be doing to help out along the way in the coming year to provide even a little bit more support for folks as they get maybe a couple reviews under their belt. And certainly I'm happy to help in any way I can. So we're at about quarter till. I'm happy to answer questions. I did want to leave some time for folks to ask questions. I know I covered a lot of information. There's no expectation on my behalf that you retain every single bit of this that we talked about. And you guys have done a great job of asking questions as they come up, and that's awesome. But I'm sure some of you are like, you know, tapping on the table with your pencil or something like that, because your wheels are turning with all of this. And that's, again, also right where you need to be. So now is your time. I'm going to just kind of mute while we wait for some questions to come in, and I'm happy to answer.
Hey, Paul, this is Darren. I just wanted to add that the process and the exposure, I remember my first IPS review training with Don Miller, and then I've been in a couple of different IPS review trainings with you, and I always pick up a little bit more. So for me, I want to kind of gather and learn as much, because the information I learned from you and through some of the questionings with the audience today, I can incorporate that so that I can improve my interviewer skills, because I know people are so anxious and people don't want to say the wrong thing to impact points. So I feel some of that's going on. So it's always helpful to have more exposure to this process. And like I said, I've taken your IPS review training a couple times, and I'm always pulling more away. So I really appreciate how you present the information and how open you are to conversations and questions. It's been very helpful for me. So thank you.
But thank you for saying so. I really appreciate it. And I guess I would say the same thing. I mean, just hearing some of the anecdotes that you've shared, Darren, I mean, I learn something every time I listen to you or Dawn, because you guys see things that I haven't seen too. I certainly haven't seen it all, that's for sure. And I think what I have learned through this Fidelity reviewer process is every time I get on a Fidelity review with a Fidelity review team, that's a learning opportunity for me. You know, and I'll just say this to every call, time you Fidelity review, you'll learn something, either something about the agency you had no idea about. You know, cool stuff is happening out there that people don't really brag about. In human services, we don't brag about ourselves very well. We don't market ourselves very well at all. But you know, you'll learn stuff from your other reviewers, even if it's just little simple things like, man, I really like the way they asked that question, because it really got exactly where the conversation needed to go. It's just, you know, this kind of, there's this guy in Illinois who's, he hung out with like Bob Drake and all those guys creating IPS when they were creating it. And so to hear him do a Fidelity review is like it's like you kind of put your pen down and you stop and watch for a minute. Just, he's so artful with how he phrases things and how he can immediately get somebody he's never met before in an interview and make them feel completely at ease and comfortable. It's just fascinating to be a part of those reviews, and I'm very thankful that my career has kind of led me down this path and gotten me, you know, in and around so many great, talented people. And it'll happen for all of you too. It's just a matter of getting out there and getting exposed to it that really is the thing that unlocks it all for you. It's endless learning, which is another thing that I love too. There's so much to learn about it. Even when you read the book cover to cover and you feel like you know it, you're still going to go someplace and get wowed by, you know, a question somebody asks, or, you know, the way they handle a certain thing. It's a neat experience.
Yeah, thank you for that, Paul, because it's really, as kind of working in one agency, I was in a bit of a silo, and coming into this position, I've met so many people from different agencies, and even bringing shared resources together to help other agencies out, particularly with certified benefit planning. So there's some really cool things that do happen going through this process. So I'm really grateful for that, to be able to be on reviews with Dawn and learn more. And hopefully there will be a time where we can be on a review, you know, as well, to kind of, you know, learn more, you know.
Yeah, that would be cool. That would be very cool. I see we've got a couple of comments. So Austin, I think he was talking about something I said earlier. He says, thanks for that level setting. I felt a bit inundated after Wednesday's class. I'm excited to build on this knowledge and to work with Dawn and Darren. It's been a great and thorough onboarding. And then he made the mistake of calling me Mr. Phares. So thank you, Austin. You can call me Paul. It's fine. I'm glad. Yeah, I think the reason, so in person is a completely different training. First of all, we started doing those earlier this year, and then COVID happened. And doing these virtually, I know Dawn and I had a lot of conversations about how do we set it up so that it's not information overload, you know, on the web. We landed on 2 different sessions, knowing that they'd both be chock full of information, and also knowing that learning about the content is kind of like, you know, one side of your brain, and learning about the process of a Fidelity review is the other part of your brain. So if you felt inundated after Wednesday, again, you're probably right where you needed to be, and you're probably feeling a different sort of inundation and information overload today. But again, there's no shortcut. There's just a lot of information is the first thing. So I'm glad you find it helpful, Austin. Julie also said it's been a great training and she's learned so much in a short time. Thank you, Julie. Much appreciated. Ronnie asked, do you have to be with an agency to be a Fidelity reviewer?
That's a really good,
question,
Ronnie.
Yeah.
Because you have to be able to contract with the state because you need a license and the state vendor number. So there's a lot of things that you need to have in place to be able to contract with the state of Washington. And we're really focused on agencies who are, FCS providers to kind of maintain the support. So we might have to, learn a little bit more about your situation to kind of see if that would fit. Because everybody attending this series, you're eligible to be an IPS reviewer. So we would have to kind of look and see if there's some workarounds or what matches up so we could look at doing that.
And I think that's consistent across the United States, Darren. I think most of these Fidelity review opportunities happen through contracts with the state. So I think at some level, even at a very basic level, you'd have to meet the criteria to be a vendor in any of the states. The only exception I could think, I was going to say the only exception I could think of would be like the group from IPSworks.org, but I would imagine they meet all the criteria to be a vendor anyway. So.
Yeah, I just want to add to the plug for the HCA because Dawn and I will be working on our statement of works for notifications for contracting for 2021 to look at baseline, where we do a review, which will be virtually, a follow-up review for agencies that we worked on this year, and expanding our reviewer team. So it's always good to think about those kind of things and talk to your supervisors or managers or agency if they're willing to do that type of contracting, because we'll be sending that out hopefully in the next couple of weeks.
That's great. It's a good opportunity for folks.
Yeah, I've heard a lot of good feedback that people are so thankful that they did the process. And I know people have some anxiety and fears about it. So this is part of that process to kind of get those questions answered or do some follow-up with Dawn and I after the presentation to address any kind of thoughts, concerns, or fears about that.
Sure. I see we have a question from Julie. She says on page 109, it says IPS specialists make at least 6 face-to-face contacts with hiring personnel. Is that per week or per month? And so I went ahead and flipped to page 109. I bet it's 108. See, one of the things I dislike about the manual is it says it's 109 up here in my toolbar, but it's 98 on the page. So I have to like figure out the lowest common denominator or something. So let's see here. It's per week. And if this is the page you're talking about, employment specialists make at least 6 face-to-face employer contacts per week on behalf of clients looking for work. Somehow I'm still not on page 109 with you, Julie, but I think that's what you're referring to is the frequency of employer contact for job development. Good question. Are there other questions? We've got about 5 till. I don't want to, if people have questions, I want to answer them. And I'm certainly happy to answer questions, via email after the fact. I would just ask that you send those questions to Dawn and Darren first, and then they will route them to me. I always try to be a little cautious with getting them correct. I don't want to cut anybody out. Does IPS provide a template for tracking, is what Sonia said. So on the IPS Works website, there are some templates available for like supervisor tracking and some of the data element tracking that we talked about. I don't think those are, what's the way for me to put this? I think agencies that track it super duper well have created their own document. And I know historically over the last probably year or so, I have shared some documents with Dawn that I have seen in my Fidelity reviews And what I do, and I would encourage Darren, you to do this too, is when I see something that's pretty slick, that works really well, I ask the organization if I can have a copy of it and share it with other organizations. And I've never had an agency say no. So when I find stuff that looks great, I put it out to whoever I know. So you might want to follow up with Dawn. I know she's got a couple copies of those sort of IPS supervisor type tracking devices that are pretty cool. And they're really just Excel spreadsheets that people have taken the time to put together to make it as easy as possible, because there's a lot of data to track. I mean, there's a lot of movement of numbers and data. As a supervisor, you've really got to be on top of.
And the HCA has created a participant log that we have at Pathways to Employment. And at the end of this presentation next week, we'll send out a copy of it to everybody, plus some of the additional forms that we talked about and some Medicaid information that I was able to get to AmeriGroup. So we'll have those links available when we send it out next week, where people can access some of those tools.
It's awesome.
But yeah, Paul, I did ask one agency. They had a really cool benefit face sheet. So I asked for that, and they were able to give it to me and said it's okay to share. So it's just like, ooh, success.
Yeah. I mean, usually most human service agencies don't have the money to like make some sort of proprietary instrument. So, you know, usually it's kind of like, that's another cool thing I think about IPS is there's such a openness to collaboration and sharing. You know, and I'll just speak kind of from Illinois, from my home state. It's no skin off my back to share something that I'm doing with an agency from downtown Chicago. Like, great for them. If they see something that I'm doing that they like, I'm happy to share it with them. I don't care. It's not going to, you know, damage my business or cut into anything I'm doing with my clients. And, you know, and the vice versa is true as well. If I called, you know, some people I know up there doing IPS and said, hey, what do you guys do for this or that or the other? And they say, oh, we do this. And I say, can you just shoot that to me in an email? They will say, absolutely. I mean, they're great. It's awesome to work with people. All of our goals are the same. We just want to help people get jobs. And Lane here puts, we'd love to have any forms or templates you have to better track this info for our organization. We've also just been making our own up as we go. Yep, you're not alone, Lane. I think that's where a lot of agencies start. And like I said, I'll give Dawn a heads up that maybe we could resend some of those forms out, like the IPS supervisor tracking document that I sent her. And then the other thing I'd encourage you to do, it's really, you know, it seems silly, but if you Google search things like that, often you can see what agencies put together. And then I'd encourage you too, if you've got somebody in your world who's really, you know, really tech savvy, really all you need is to take the Fidelity Scale and sort of convert it into an Excel spreadsheet sort of document. And then you got it. You know, you just need to find somebody that can help you make it look pretty and make it user friendly. And so for a lot of organizations, you know, until they find that person that can kind of demystify some of those things, they're stuck with something that's not quite as good as they'd like. So I'd encourage you to get creative. And now with automation, I mean, there's a whole next level of integration you could do between like cloud services or, you know, network type hosting where, you know, if employment specialist A types something in a document, you can share that to the cloud and then everybody knows that entry has been made, you know, and that's all about having the time to set all that up, really. But there's some really fascinating stuff that, you know, you have the ability to do, especially if your organization is like, you know, an adopter of like all of the Google suite of documents, like Google Sheets and Google Docs, and there's things you can do across multiple Google platforms that are pretty spectacular. I was at an agency one time, and I know we're at time, but I was at an agency one time, and everything they did with their organization was through like the Google suite of documentation, like Docs and Sheets and everything. Oh. And it was such that they could pull a report for me out of Google that showed me like by map touches exactly how much time they were spending off site. It was pretty slick. I have to be honest, I can't recreate it, but it was pretty slick. I know enough about that stuff to be dangerous, but not enough to like actually do it. It was neat. It was neat.
That sounds slick.
Yeah. We are at 1 after. I know I know we're supposed to end at the hour, Darren. So without any further questions, I don't have anything further. If people email you and Dawn with questions, I'm happy to answer them if you just shoot them to me.
Okay, that sounds great. Yeah, we'll send some information out. So definitely, if there's some other questions that come up, please contact Don Miller or Darren Paskey, and we'll do that. And then I'll look forward to following up with you, Ronnie, to see about your situation for contracting to be part of the review team. Thank
All
you
right.
all today.
Awesome. Thanks, everybody.
Thank
Have a great
you.
day. Bye.
Have a great weekend, everybody.
Bye.
No, it's not working. Let me stop. That's weird. Choose someone to host the after leave. And it was weird.